Good morning. It is 9 a.m. and I'd like to call this meeting to order and ask that Ms. Pruteau please call the roll.
Good morning. Kasuga,
Here.
Cervantes, Fu, Harb Sheets,
Here.
Nystrom,
Here.
Phillips, Riscate, Rogers,
Here.
Tate.
Here.
Thank you.
Thank you. And we just barely made quorum, but we're here and it is established. Um, Thank you to everyone for joining this morning. I am Leah Tate, and it's my pleasure to welcome you to the California Board of Psychology meeting. We have a very robust agenda today, and the board is glad you're here with us this morning. Continuing Professional Development, or CPD, credit will be available for attending this meeting today. I'm going to give Ms. McCochran a few minutes to share how to properly document your attendance for CPD credit. Ms. McCochran, please.
Hi, good morning. Thank you. So attending today's board meeting provides you with CPG credit for your CPG records. Please notate today's date is May 19th, 2023, and note that we are here for the board meeting. At the end of the board meeting, I will announce how many hours you can be credited. If you called into the meeting, please email bopce@dca.ca.gov with your license number and the phone number used to call in. And if you signed in using the computer or mobile device, your attendance is automatically documented and no further information is necessary. Back to you, Dr. Tate.
Perfect. Thank you so much for the clarification. We're going to head right into Dr. Rogers' much anticipated mindfulness exercise. Dr. Rogers?
Dr. Tate, please don't say much anticipated. That puts a lot of pressure on.
Everyone loves it. So
I kid. I am always so thankful to lead us through a brief mindfulness practice before we get started with our meeting. So thank you again for the opportunity. So as I was thinking about what I wanted to share today, I was actually reflecting on this immense sense of joy and gratitude I had upon waking yesterday, as I was preparing to do my last minute review of all of the materials for today. And I was struck by how profoundly grateful I am to do several things. One, to do a job that I love. I love being a psychologist. I feel so fortunate and grateful to serve my profession in this way by being on the board. I'm also profoundly grateful for my colleagues on this board. Not only are you all immensely talented and deliberative when it comes to issues related to consumer protection and all the matters related to the board, but you're all just good human beings. And I just am so thankful to know each and every one of you. So I thought, why don't we spend a little time centering our hearts on the things that we're grateful for, no matter how big, no matter how small, no matter how recent, or no matter how distant those experiences might be. So I thought we would just spend a little time exploring gratitude today. So, finding a comfortable position that is supportive for your practice. Most people are sitting, I imagine. There may be a few folks who might be standing or even lying down. What I love about mindfulness is that you get to decide what's most supportive for you in this moment. So, whatever that is, Find a position that's comfortable. I am sitting in a chair, my feet are on the floor. But really just listening to your body in this moment. What does the body need? It's always a great question to start with. And is there anything that you could do to adjust so that you're feeling comfortable and supported in this moment? And maybe asking, is there anything you could soften? Are there any places of tension, tightness, holding? Anything that you could relax and soften. Maybe softening the chest, the belly, the jaw. And if it feels comfortable, you might close your eyes or softly and gently lower your gaze so that we can go inward for just a few moments. There's lots on the agenda to cover, but for these few moments, there's nothing to do but to allow our minds, our hearts, and our bodies to rest and be still. Letting gravity have its way with you, allowing yourself to surrender and connect with the feeling of being supported. Feeling supported by the chair beneath you, the ground underneath you. And no matter where we are in the great state of California, the earth is beneath us all, supporting each and every one of us in this moment. So even though we may be separated, we're all still connected in this moment together. And as we settle, spending a few moments centering our attention on the breath. The breath is with us all the time, no matter where we are, no matter what we're doing. And it is always our portal to the present moment. We can't breathe 5 minutes ago, and we can't breathe 5 minutes from now. We can only breathe in this moment. So it's a very simple and gentle anchor to the here and now. It brings us back to our bodies. It can be centering, it can be stabilizing. And if we let it, it can help us access a sense of calm, a sense of peace, and a sense of ease, no matter what's happening around us. So allow the practice of being connected to the breath bring you right back to the palace of the present moment. Perhaps tracking a few cycles of the breath, noticing the inhale, followed by the exhale. And if the mind wanders, you can just bring it back to the sensation of breathing in and breathing out. And as we allow our bodies to be still, and centering our attention on the breath, maybe moving our attention to our heart space, just checking in with the heart. Is the heart open? Is the heart closed in some way? Is the heart anxious, guarded? Whatever it is, there's no judgment. It's not a problem. Just doing a gentle inquiry to see what wants to be known. And since the practice we'll do today is that of gratitude, perhaps as we call these things to our mind and our heart, these things might gladden the heart a bit. So for the next few moments, bring to the mind and bring to the heart those things that you're grateful for. Again, no matter how big, no matter how small. But what do you appreciate? What are you thankful for? It might be for the cup of coffee or tea you had this morning. Perhaps it's the sunshine, or a distant memory from years ago with a loved one, or someone extending you kindness. Just let your heart rest on whatever it is that has come up for you. And then notice, how does gratitude feel in the body? What do I notice in my body right now as I reflect on this gratitude? Maybe you notice a tingling in the heart space, or a gentle smile on your face. whatever it is that's coming up for you, allow that to be a source of nourishment for you in this moment and throughout the day. Allow gratitude to be a touch point for you. And as we bring this practice to a close, we return our attention to the stillness of the body and the movement of the breath. And when you're ready, I will ring a soft bell, and you can bring your attention back into the room. Thank you for your practice.
Thank you so much, Dr. Rogers. You do such a great job of helping center the beginning of our meeting. I would like to open up for board comment on the President's Welcome. Seeing none, Ms. Moderator, can you please open up public comment for the President's Welcome?
Certainly. We are opening up the WebEx Q&A feature to facilitate public comment. If you'd like to make a comment, you can look for the question mark icon, typically in the lower right of your WebEx screen. And once you click on that, you can type the word comment in the text box and click send. The other option, of course, is to raise your hand by clicking once on the hand icon. And if you are a call-in user, you can press *3 to raise your hand. I do see that Board Member Fu is in the audience at this point, so I will go ahead and promote you. One moment. And let's see, I do have some raised hands. One moment as I recognize those. And hopefully this will be in the order of the hand raises. Let's see. And so Board Member Fu, so we have a request to comment from June Hayes. June, I'm going to send you a request to unmute. And June, are you able to unmute yourself? You should have gotten a request, a pop-up on your screen. And to Board Member Seiron Fu, you should be able to unmute yourself at this point just to make sure that you've got that microphone privilege.
Good morning. This is Seiron Fu, and asking that the notes reflect that I am in attendance. Thank you.
Perfect. And June, if you prefer, you can put your comment into the Q&A. And again, that is accessed by clicking on the question mark icon in the lower right of your screen. And I do not see any other requests for comment at this time. Oh, Lee Solo. Lee, I'm going to send you a request to unmute your microphone, and you'll have, let's see, 2 minutes to speak. And Lee, did you get a request to unmute your microphone? It may be behind the three dot other options since you're on a mobile device. And June, apparently her question is if we need to attend the entire meeting or only credit for number of hours we can attend. I will defer to board staff for the answer to that.
Can you hear me
Hi,
now?
this is
Yes.
I just was wondering where you write questions on the iPad. Since I don't see the question mark, I only see the hand.
All right, that's fair. You can certainly use the hand raise function. Did you have a question on the president's welcome?
No, thank you.
All right, thank you.
Hi, this is Lizelle. I'm going to answer Dr. Hayes' question of if we need to attend the entire meeting or only credit for number of hours we can attend. So you will receive the credit. You will receive credit for the number of hours you can attend. If you stay for longer than 3 hours, then you'll credit yourself 6 hours. If it's less, if you stay less than 3 hours, you just credit hour for hour. Thank you.
And then we do have a question from GK, and I can certainly send GK a request to unmute their microphone. And you're unmuted.
All right, just curious, why isn't this meeting listed on the DCA's webpage under the webcast calendar? And it's also not being live webcast for those who are general public like me who are not psychologists, but would just like to listen into different board meetings. Just curious why it's not listed on that page. Thank you.
And thank you. And it looks like that is all the questions and raised hands we have at this time. Shall I close public comment?
Yes, thank you, Ms.
You're
Moderator.
welcome. You're welcome.
And Ms. Sorek, are you still on this call at this time? I just wanted to, sorry.
For a moment. Did I miss a question?
No. I just wanted to, the last comment was that our meeting is not on the DCA website. So I just wanted to double check on that. And
Ms. Pruteau, can you answer that question?
Hi, this is Sarah. Office of Public Affairs had contacted us within the last month or so that they had conflicts and they were not able to webcast this meeting through the DCA page. So I assume that that's why they took it off that page.
Got it. But it is still webcast and the link is on the agenda.
Correct.
okay, so anyone can click on our page, go to the agenda,
Exactly.
and jump into the meeting. Okay,
Correct.
I was worried about that.
Yes, it's publicly available. Yes.
Okay, thank you so much. We're going to move on to agenda item number 3. This is public comment for items not on the agenda. The board may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. Before I invite speakers to come forward for public comment, I would ask individuals making comments to not discuss the specifics, including names, as to pending complaints, pending licensing applications, or pending disciplinary actions that may come before the board. Such discussions are considered ex parte communications as they could provide information to the members that is outside of the record in violation of the Administrative Procedure Act. Although this may give the impression we are not being responsive, these procedures are critical to ensure the compliance with the Open Meetings Act and to avoid compromising the speaker's goals or the board's mission. If there is a speaker before you who expresses thoughts that are extremely similar to yours, please feel free to verbally agree with previous speakers instead of repeating the exact same comments. And each speaker will have 2 minutes. Ms. Moderator, can you open up public comment?
Certainly, and we've opened up the Q&A feature to facilitate public comment. If anyone would like to make a comment, they may look for the question mark icon, and typically that's in the lower right of your computer screen or behind the 3-dot other options if you are on a mobile device. And if you are a call-in user, you may press *3 to raise your hand, and anyone may raise their hand by clicking on the hand icon. Each speaker will have 2 minutes with a 30-second warning.
President Tate, this is Dr. Kasuga.
Yes.
Just wanted to inform you and everyone in the meeting that I will be stepping out of the meeting for about 15 minutes, and I will come back around 9:45.
Okay, thank you. And please announce when you come back so we can get you back on the record.
Most certainly. Thank you.
Thank you.
And this is the moderator. I do not see any raised hands or requests for public comment. Shall I close the public comment period?
Yes, please. And thank you very much.
You're welcome.
We'll be moving on to agenda item number 4, discussion and possible approval of the board meeting minutes for February 2nd and 3rd, 2023. Is there any board comment regarding this item? If there is no board comment, is there a motion?
It's Dr. Harpsheets. I move that we adopt the minutes for the February 2nd and 3rd board meeting.
I second. This is Shakanda Rogers.
Perfect. We have a motion and a second. Any other board comment before I open up public comment? I'm not seeing any hands. Ms. Moderator, can you please open up public comment for this item?
Absolutely. We've opened up the WebEx Q&A to facilitate public comment. If anyone has any comment on the minutes and the motion, you can look for the question mark icon, click that, type the word comment and click send, or you may raise your hand. Each speaker will have 2 minutes to speak with a 30-second warning. Are there any comments on the minutes? I do not see any requests for comment. Shall I close the public comment feature?
Yes, please. That would be great.
Thank you.
We have a motion by Dr. Harpsheets and a second by Dr. Rogers. Any other board comment on minutes? Ms. Pruteau, can you please call the roll?
Kasuga. I'm sorry, can you hear me?
Yes, Dr. Kasuga just stepped out.
Oh, that's right. Okay, she just left. I apologize. Fu.
Aye.
Harpsheets.
Aye.
Nystrom.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you.
Thank you. Motion passes. Moving on to item number 5. This is discussion and possible approval of the board meeting minutes dated April 7th, 2023. I'm opening this up for board comment or a possible motion. Oh, Ms. Nystrom, I see your hand is up.
Oh, yes, I was absent for the April 7th board meeting, so I will abstain on the minutes.
Okay, thank you.
This is Dr. Harp Sheets. I move that we accept the board meeting minutes of the April 7th board meeting.
I second. This is Seiron.
Thank you. We have a motion by Dr. Harp Sheets and a second by Mr. Fu. Any other board comment before I open up public comment? Ms. Moderator, can you please open up public comment?
Certainly, and we've opened up the WebEx Q&A feature to facilitate public comment. If you'd like to make a comment on this set of minutes, you can look for the question mark icon, type the word comment in the text box and click send, or raise your hand by clicking on the hand icon. Each speaker will have 2 minutes with a 30-second warning. Any comments on this set of minutes? I do not see any requests for public comment. Shall I close the public comment feature?
Yes, please.
Thank you.
So we do have a motion by Dr. Harp Sheets and a second by Mr. Fu. Can you please call the roll?
Fu,
Aye.
Harp Sheets,
Aye.
Rogers,
Aye.
Tate,
Aye. Thank you, Ms. Berteau. We do not have quorum for this item, so we will have to revisit approval of this item when Dr. Kasuga returns. We're moving on to agenda item number 6. This is the president's report. I'd like to highlight that the meeting calendar is available in the agenda packet, and this calendar has our committee meetings and our next full board meeting, which is scheduled for August 18th, and this will be a WebEx event. And just for future planning purposes, the next full board meeting after the August meeting will be November 2nd and 3rd, 2023, and this will be an in-person event in Los Angeles, California. Is there any board comment on the president's report?
Madam President, this is Seiron Fu.
Yes, Mr. Fu.
Question maybe to council. Are we allowed to continue proceeding? We don't have quorum?
We have quorum, but Ms. Nystrom abstained.
Oh, understood.
So,
Understood. Okay, thank you.
but thank you for your interest. Again, board comment for the president's report. Oh, Mr. Fu, is your hand up again, or is that a?
It's a lagging hand.
Got it. Ms. Moderator, can you please open up for public comment regarding the president's report?
Of course, and we've opened up the WebEx Q&A to facilitate public comment. If anyone has a comment on the president's report, you can look for the question mark icon, type the word comment and click send, or raise your hand. And each speaker will have 2 minutes with a 30-second warning. Any comments on the report? And I do not see any requests for comment. Shall I close that feature?
Yes, please, and thank you so much.
You're welcome.
Agenda item number 7 is the executive officer's report. Ms. Sorick, please.
Good morning, board members and attendees and staff. Included in the meeting materials is the executive officer's report. And you'll see the personnel update in the meeting materials. We have 3 individuals, Cynthia Whitney, Curtis Gardner, and Diana Fleming, all joining the Central Services Unit. So the Central Services Unit is now fully staffed and with some additional assistance from Diana Fleming, formerly Diana Brown. We have some onboarding training for our receptionist, Cecilia. So this is all good news. No current vacancies with the board as of today. also wanted to report that the staff will be sending out a link to the Barriers to Telehealth survey that the board has been discussing. And this survey will be shared with stakeholders within this month is the goal. Solid Unit is working on compiling our questions into a SurveyMonkey mechanism so that we can send that link out. And the hope is to have that survey live for 3 weeks. And we will be sharing the survey results at the August meeting and also discussing what organizations we would like to go ahead and share the results with. Also included in the materials is the annual report to the state legislature. This would be for fiscal year 21-22, something that we share with the board once a year when it's ready. And you can see what our accomplishments were, the board highlights, and some of the data that we provide to the legislature each year. So I'm available if the board has any questions.
Any board comment for Ms. Sorek? Excuse me. I'm scrolling through slowly just to see. I'm not seeing any board comment. Ms. Moderator, can you please open up public comment for the executive officer's report?
Certainly. And we've opened up the WebEx Q&A to facilitate public comment. If anyone has any comments on the executive officer report, you can look for the question mark icon, type the word comment and click send, or raise your hand. Each speaker will have 2 minutes with a 30-second warning. Are there any comments on the EO report? I do not see any requests for comments. Shall I close that feature?
Yes, please.
Thank you.
Thank you, Ms. Sorek. We are moving on to agenda item number 8, which is the DCA update, and this will be provided by Ms. Judy Bucciarelli. Are you with us today, Ms. Bucciarelli?
One moment while I give Ms. Bucciarelli access to her microphone. Thank you for your patience. And Judy, you should be able to unmute yourself now.
Good morning. Can you hear me?
Yes, we can.
Oh, perfect. Okay, I'll get started. Good morning, board members, and thank you for the opportunity to provide the Department of Consumer Affairs update today. Since 2017, the state of California has participated in Public Service Recognition Week to express appreciation for civil servants and the essential work they do. During the week of May 7th, DCA celebrated the week with a department-wide appreciation message to staff, social media highlighting staff testimonials, and ended the week with a video highlighting employee service. On behalf of DCA, I would like to express thanks to the board and board staff for your hard work throughout the year. Next, I'd like to inform you that DCA's printing provider is currently experiencing technical difficulties, and as a result, the printing of many of the DCA board's renewals, certificates, licenses, and letters is delayed. Printing interruptions began on April 13th, 2023. DCA is working closely with the printing provider, and at this time, the estimated time of restoration has not yet been determined. DCA shared messaging with the impacted boards, and until the issue is resolved, licensees should be encouraged to take advantage of online services. DCA will continue to provide updates as more information becomes available. Moving on, I will provide a diversity, equity, and inclusion update. Established last fall, the department's DEI steering committee is comprised of 12 executive leaders from the boards, bureaus, and department, and has been working on many items, including updating the strategic planning process, training, and development of an informational DEI fact sheet, which was distributed to board leadership. The strategic planning process has been updated to embed DEI into the process, which includes a survey, DEI section in the environmental scan, video messages, and a brief training video. If DCA Solid team has not already reached out to the executive officer to discuss a plan to develop the board's strategic plan, the team will do so by the end of June. In addition, all DCA Solid trainers will be completing a 50-hour diversity, equity, and inclusion training certification program through the University of Massachusetts. On April 28th, 2023, Director Kirchmeier issued a memorandum on DCA's commitment to employees to increase the availability of DEI courses through DCA Solid Training Unit. A DEI section has been added to the homepage of the Learning Management System, where employees can access and register for 3 courses available in June. Over the coming months, additional courses and educational information will be available. DCA's first diversity, equity, and inclusion fact sheet has been released. It was developed as an informational tool and includes the department's 3 DEI initiatives, memorializes DCA services that support DEI efforts, and includes DEI terminology as it applies to DCA. On May 12th, the DEI Steering Committee held its quarterly meeting in person and elected a chairperson and vice chairperson. Yefana Lamar from CSOB will serve as the committee chair, and Paul Sanchez, Executive Officer of Speech Language Pathology and Audiology and Hearing Aid Dispensers Board, will serve as the vice chair. The committee also discussed training, strategic planning, and DEI activities through the end of the calendar year, as well as membership composition and processes to expand membership. As the DEI Steering Committee's work continues, I look forward to updating you in the months ahead on their progress. Equally important, I'd like to make you aware that there are 2 DCA-wide mandatory trainings for 2023. This includes sexual harassment prevention training and information security awareness. All DCA employees and appointees, including board and advisory council members, will need to complete the sexual harassment prevention training this year. Board members must take the 2-hour supervisory training that is required every odd-numbered year. This training is online, self-paced, and takes approximately 2 hours. In addition, board members with an assigned DCA email are also required to complete information security awareness fundamentals training. This training addresses everyone's role in protecting DCA data and information. Training is online and required every year. Both the sexual harassment prevention training and information security awareness training are available in the department's learning management system. For more information, a mandatory trainings page has been created to help members identify, access, and track specified trainings. The page includes direct links to the mandatory trainings, as well as pertinent information and policies specific to these training courses. You can go to dca.ca.gov and click on the DCA Board Member Resource Center page under Required Board Member Training. You may also reach out to Board and Bureau Relations Chief Deputy Melissa Gear or Assistant Chief Deputy Yvonne Durantes for assistance. As a reminder, the next board member orientation training, also referred to as BMOT, will be held on June 20th, 2023. Board members must complete BMOT within 1 year of their appointment or reappointment. On June 20th, BMOT will be offered in person in Sacramento, and again on October 10th at a location to be determined. Members can register for this training in the learning management system. Next, as the fiscal year comes to an end, I'd like to remind you to please submit your travel expense claims as soon as possible, but no later than 5 p.m. on Wednesday, June 8th. Claims submitted after this date will be processed. However, they will not be paid until July. If you have any questions regarding travel claims, please contact Melissa Gear. Moving on, as you are all aware, legislation passed last year amending provisions of the Bagley-Keene Open Meeting Act to extend the ability of state bodies such as DCA's boards and bureaus to conduct public meetings virtually through July 1, 2023. Absent the passing of new legislation to extend these provisions, DCA's boards and bureaus will not be allowed to conduct meetings virtually after July 1. DCA is aware of the legislation recently introduced, which removes certain teleconference requirements from the Open Meeting Act. The bill was recently amended to do the following. 1, require members of state body participating remotely to disclose whether any individuals 18 years of age or older are present in the room at the remote location and the general nature of the members' relationship with those individuals. 2, require state bodies to end or adjourn a meeting upon discovering that a means of remote participation required by the bill has failed and cannot be restored. This bill does not include an urgency clause and would not take effect until January 1, 2024. Boards and bureaus should be prepared to conduct public meetings in person in the interim beginning July 1, 2023. Next, I'll share information about the federal portability law. On January 5th, 2023, a new federal law took effect that enables service members and their spouses who hold professional licenses in a different state to practice in California within the same professional discipline and at a similar scope of practice if they are required to relocate to California due to their military orders. Since becoming aware of the new law, DCA has been collaborating with agency on best how to implement the law. DCA will share information as it becomes available. In the meantime, should your board receive an inquiry from a service member or spouse regarding this new law, please contact DCA Legal Affairs. And finally, DCA submitted its 2021-22 annual report to the legislature, and the report is now available on the DCA website. This annual report includes a new design and additional reporting metrics such as military licensing data now required for all DCA boards and bureaus. We hope you will take the time to review this impressive compilation of valuable work of the boards and bureaus. This concludes the DCA update, and I will hand it back to President Tate, and I welcome any questions from the board.
Thank you so much, Ms. Bucciarelli, for your presentation. And thank you for DCA's commitment to DEI concerns and supporting the DEI efforts. I appreciate that.
You're welcome.
Any board comment? I see Ms. Nystrom already has a hand up. Go ahead.
Good morning. Just one quick question. With respect to the DCA solid trainers having a DEI certification program through the University of Massachusetts, can you give us some insight as to why we went with the University of Massachusetts over one of our California universities?
Okay, that is a very good question, which I don't have the answer to.
Okay.
But what I would suggest is maybe work through the executive officer, and maybe an email can be sent to Melissa Gear, and she would be able to research that with Solid and then get that answer back to you.
Okay, great. Thank you very much.
You're welcome.
Thank you for your update.
Mr. Fu, I see your hand up as well.
Thank you so much. A couple questions. The first question is with regard to the printing piece, and I'm curious what is affected by the printing issue. So a couple board publications come to mind, key important ones related to sexual misconduct between a client and a licensed therapist. And so I'm curious, what is being currently affected by the printing issue?
Okay, if I go back in my notes, I believe it is just the printing of renewals. Let me go back here and look at my notes. Okay, so my update references just the printing of licenses and renewals and things of that sort. I don't know if publications have been impacted by this printing delay. I can certainly send an email to my chief deputy and get the answer to that question as well.
Thank you. Can I ask Madam President, may I ask a question to Ms. Chung real quickly?
Sure, if it relates.
It does. Ms. Chung, if you're available, how does the delay in the printing of licenses and license renewals affect applicants for licensure who've been approved, or for any of our licensees who are renewing? Is it purely I just don't have my physical renewal printed, or are there broader operational implications?
Thank you, Mr. Fu. From my understanding from the notices that we receive, I think it's just the certificates. It doesn't impact the ability to practice for newly licensed licensee on our end. And regarding renewal, we are just printing a courtesy postcard to our current licensee if they're up for renewals. And anything else. So that would be like the same, like the newly licensed in psychologists, they won't be impacted on their practices, ability to practice, but it's just the physical certificates that are being delayed.
Understood. And have you received any questions from people, from our stakeholders related to delays?
I haven't actually.
Okay, great. That's really helpful. Thank you. And then my second question is probably more related to when Mr. Burke presents on the budget update. But I think since we do have Ms. Bucciarelli here, I'm curious if there is an update from the DCA department and on any forward guidance that you're providing to consumer boards with relation to the budget, given the recent May revision. Thank you.
That I would think that you would address that when the budget update is provided to the board. I don't have that information on anything related to the budget.
Understood. That's really helpful. And I wonder, Madam President, if there's a opportunity in the future for us to think about how I really appreciate the DCA updates that Ms. Bucciarelli just provided us. And a lot of the budget information does come from DCA as well. And while we have a separate item on our budget, that doesn't necessarily always cover the bigger 35,000 foot level from the department end. And so I wonder if we can continue to have opportunities to make sure that the DCA update has some component to include the budget.
Okay, thank you. Good suggestion. And we have an agenda item way later that, so keep that in mind, Mr. Fu, so we can keep it on for future agendas. Ms. Chung, I see your hand up.
Yes, thank you, President Tate. I just want to add that regarding the print issue, it seems like it's affecting another system. It's called CAS, but the board is not using that system. So I just want to clarify that that's why we're not running into questions that we have. Thank you.
Thank you, Ms. Chung. Any other board comment before I open up public comment? Ms. Chung, do you have another question, or is that a hand just happy?
Sorry.
Not a problem. Ms. Moderator, can you please open up public comment for DCA update?
Certainly, we've opened up the WebEx Q&A feature to facilitate public comment. If anyone has a comment on the DCA update, you can look for the question mark icon, type the word comment and click send, or raise your hand. I see we do have a hand raised from Vivian Lamfier. Vivian, I'm going to send you a request to unmute your microphone and you'll have 2 minutes to speak. You're unmuted.
I just wanted clarification on the definition of equity.
Okay, is there any other comment or? I'll defer to the board president on how to proceed.
Thank you. Ms. Pucciarelli, if you have the definition that DCA is using?
I actually don't have that in front of me, but what I can do is have Melissa email that to the executive officer, and maybe she could provide that to the caller.
Okay, thank you. Or in our next DCA update, just provide the definition as well too.
Yeah, I think the definition of each term is important. I mean, I would like to know what the definition of each term is. It's an important concept that that I would imagine everyone would have.
Thank you for your comment.
President Tate?
Yes, Mr. Burke.
John Burke, Assistant Executive Officer. I actually do have the definition of equity as provided by the Department of Consumer Affairs in their fact sheet. Would you like me to read it?
Absolutely. Thank you.
Equity creates paths to equal outcomes by recognizing that some people and communities have unequal starting points driven by different histories, historical treatment, circumstances, strengths, and needs. And that's from the DCA fact sheet that was shared with all staff last month, I believe.
Perfect. Thank you so much.
No problem.
Ms. Moderator?
All right, and I do not see any other requests for comment. Shall I close the public comment feature?
Yes, please. And
Thank
thanks
you.
for the help. We're going to move on to agenda item number 9, and this is the vault presentation. We have 3 individuals for our substance testing vendor, Mr. Mose, Mr. Ferguson, and Vice President Allschlager. And I'm sure I butchered it, so I apologize. Are all 3 of them promoted to panelists at this time?
I have promoted Jordan Olschlager and I have made them presenters so they can control the slides. I do not see either of the others logged in under that name in the WebEx meeting. Jordan, did you have any update?
Yep, Dr. Ferguson should be joining here momentarily, but we can get started and I can lead the presentation.
Thank you.
And moderator, are you going to be sharing the screen, or let me see? Actually, I have permission. I'll do it. Oh, actually looks like I'm not able to. Can you just share the screen, moderator, again? Or the slides that we prepared? Perfect.
And I have promoted Dr. James Ferguson as well. Thank you.
And I beg your pardon. This is Evan at the board. I was attempting to share my screen and moderate the slideshow.
Was that your hope, Evan? Was you were going to annotate this?
Not to annotate it. I was simply going to share my screen, which has the slideshow. However, I can certainly stop sharing and let Mr. Olschlager run the show.
Nope, this is perfect. Thank you, Evan.
Okay, certainly.
Evan, if you could proceed, let's just go to just the agenda slide. Thank you. Hey, everyone, just like you heard, my name is Jordan Olschlager. I'm Vice President of Vault, and we are the testing provider that you guys are currently using for substance abuse. And what our plan for this afternoon, or this morning, excuse me, is just to walk through just our company overview. I am going to go through the slides at a high level, and for those who are interested, we're happy to share some of the slides after. And then really just provide an update as far as the testing we're doing for the DCA, the board currently, and then also answer some additional questions at the end. So with that, I'm going to jump on in. If you want to go to the next slide, please, Evan. Thank you. So just an overview of our organization. Our organization has been in existence for over 33 years. It has had a few different names, which I will share on a future slide. But the nature of our organization is we provide workforce screening technology, services, and testing across the board. Our specialty is we have various platforms that allow for random testing, in addition to quite a large clinical network across the United States that allows for easy access to testing where it's needed. Next slide. Joining me on this call is Dr. Ferguson, who's our MRO, specifically for the Recovery Management Services Division, which is a service that you all are utilizing currently from our organization, and will be available for any specific questions about the testing we're doing for your board. And if you go to the next slide, thank you. So I referenced earlier, we've had a few different names. Once FS Solutions, now we go by Vault Workforce Screening. And our main priority is, once again, to provide seamless testings and compliance for organizations. And we do that for well over 500 companies across the United States, in addition to many state and government organizations as well. So who is us? Like I said earlier, we've been around since 1989, and you can see some of the various programs we provide. But what we provide right now for the board is we provide recovery management services for all the licensed professionals. In addition, we also do background screening, drug and alcohol testing, and a few other services that you can see here on the screen. And all these comprehensive services is what allows us to provide comprehensive services, easy access, and more importantly, compliant reporting for the various stakeholders. Let's go to the next slide. Thank you. So when it comes to recovery monitoring solutions, we utilize a proprietary technology, which I'll show some insights that support case managers as they're managing those who are on recovery management. And what this allows for us is to serve public safety and good, to help those that have had challenges in the past remain sober and remain in compliance with their various programs. Go to the next slide. Thank you. So this is a nice summary of kind of the two different service lines. The service line right now that the board is utilizing is the one on the right, which is called Recovery Management Services. And you can see that we offer these services to a variety of different programs, many state programs, treatment centers, etc. And when you think of recovery management services, it's a variety of different drug and/or alcohol testing, including daily monitoring that allows us to keep participants in compliance. And obviously this is overseen by our MRO, Dr. Ferguson, who's on the call with us. Next slide. Thank you. I think it's always fun, just like I said earlier, just to share that we are very proud of our relationship with DCA, with the board, and we also have some relationships with many other states as well. We're able to provide this service to various different health individuals. Next slide. Thank you, Evan. And what's most important as part of our program beyond the technology is, you can see here, is access. And when you're getting drug tested, whether it be for drug or alcohol, obviously it's a disruption to your day. And so we have built a significant collection network. Once again, these are different locations spread throughout California. And you can see obviously throughout the nation that allow you to get easy access to testing when it's needed for a random test. Thank you. If you have to go to the next slide here. So how we do this is obviously, the board has access to our team. We have a specific team that surrounds the board, provides reporting, is available for those that are in the program to have access to our team as well if they have questions. And really pride ourselves on providing, exceptional service and making sure that we're able to meet the needs of those that are in our various recovery programs. Next slide. So just kind of another summary of that is it's all about customer service from our perspective. And we believe that through that and through our platforms and through random testing, we're able to help those individuals that are on the pathway to recovery remain sober, remain compliant with their programs in order to continue to do what they're doing. And through that, serve the broader public safety agenda. This is just some, we always like to include this in our conversations. We've been doing this, like we said, for quite a long time. And so including just some examples of things that our various partners that we've been working with have said about us and are proud of doing us, are proud of the relationship they have with us. Next slide. So like I said earlier, how we provide these recovery management services for those program participants is twofold. We have a platform, which I'm going to just share a few slides that just highlights kind of what this program is, the platform enables. And then beyond the platform, we obviously have the testing itself, which is the collection sites, or in some situations, the oral fluids collection that takes place. And so you can see here that this is a summary of kind of our platform overview. Caseworthy is the name of our system. And really what this allows for is a central hub of all information and one place for the case manager or the participant. And when I say the participant, I am referencing the individual that is in recovery, and is the place that basically they can go for all their information and check in daily, see results, ask questions, etc. Once again, the goal of all of this is just efficiency, accuracy, and most importantly is compliance. Next slide. So our platform has many different features. For those that have seen it and are able to see, I'm not going to read through all these, but I think what I'll key in on a few things is we recognize that more and more today's society is on mobile phones, and so our platform is easily utilized on phones. It obviously has a lot of different communication tools that we're using to make it easy to use for those that have to access it. And most importantly is just reporting and information for whether it be the board, the case managers who are working with the participants, or the participants themselves, so that people can have access to the right information. And not surprising in today's society, data security and management, especially as more and more things are in the cloud, is really important to us. And so we stress the fact that our platform is obviously very secure, reliable, with multiple different safeguards that are put in place, because the information of those who are in this program is proprietary, and we want to make sure we're keeping it secure. And you can see here some of the steps that we've taken as an organization to ensure that we're managing that data safely and securely. So I have two last slides here, and if you go back to the previous slide, I think, oh, okay, sorry, yep, perfect. So, oh, yeah, you can skip to the, I apologize, Evan. Yep, perfect, one more slide, there you go. So one of the common questions we get is we provide a variety of different test options that are available for those that are in the program. And what we wanted to highlight here, and I'll allow Dr. Ferguson, if you want to come off mute and expounding more on this, is this just a summary of when you have substances, how long those substances are able to be detected for, depending upon the test utilized. So we obviously have the ability to provide a variety of different tests, whether it be a hair test, a nail test, a blood test for PEth, just a standard blood test, an oral test, urine, sweat, etc., etc. And you can see on this grid, it just shows how long the various substances are detectable based on those tests. And last, I just want to provide some summary data on the current program right now, as far as for the board. And you can see here, on the left side, you can see here that on average, how many, I think this is September up to the past 6 months, you can see here how much testing we've done for this particular program. And you can see we're primarily using one lab named DrugScan with one primary panel. And you can see on the right just our given turnaround time. One of the bigger stats right now that we track just for efficiency is how fast we're able to get results to those stakeholders that are requiring it. I'm going to pause here for well, I don't know if we have any questions, but I know that I went through that very fast. Once again, we're happy to share some information for those that are needed. Once again, we're Vault Workforce Screenings, and just want to provide a little bit of insight to the program that we have been providing for quite a long time for the board, and some of the technology that is being done behind the scenes. Thank you.
Thank you so much. I'm so glad you're here because sometimes we have questions around the testing. So I'm grateful that you made the time. And it looks like we have a board member who has a question already. Mr. Fu?
Thank you, Madam President. And hi, Mr. Olschlager. Thanks so much for joining us today. I'm curious to understand, and you showed that slide where different types of tests or different types of sample have different types of detectability over a certain period of time. And so I'm curious to understand from your perspective, when a person misses a requested testing to come in, on our end, it's procedurally considered a violation of their probation. And I'm curious, if they missed a random test but they came in the next day, it looks like those, based on the detectability time periods, you have different types of tests to accommodate that detection of the substance use in the hair, for example, which looks like it was, the bar graph was 2 years even. So I'm curious to hear from your perspective when the randomization perspective becomes negligible given the length of time a sample, a length of detectability a sample can provide.
Dr. Ferguson, do you want to take a first pass at that, or would you like me?
I'll do it. Can everybody hear me okay?
We can.
Okay. The answer to your question is it's not as straightforward as it seems. All the specimens are different. All the specimens have different drug and alcohol uptake and retention characteristics. The hair that we would like to see people collect is actually only a 90-day detection window, except that after use, the drug, if it's going to show up in hair at all, doesn't do that for maybe as long as 10 to 14 days. So if somebody misses a test on one day, doing a hair test the next day is not a great idea. The forensic backbone of the program is always urine. We do follow up with teeth in blood, hair, nails if necessary, on a case-by-case basis, depending on what exactly happened and why a test was missed, how much time's been involved. When we show those detection windows, those are average detection windows, but remember, we don't exactly know how long it's been since drug ingestion happened when the test specimen is being collected. So the test can actually be done at the very end, for example, of the urine 3-day detection window. So is that really, are we looking at 3 days or we're looking at just the end of it? So there's a lot of variables here, and that's why we use so many different specimens to try to account for all the variables, but it's sometimes not as straightforward as it seems.
Thank you, Dr. Ferguson. That was really helpful. And a follow-up question then I have is, I think we're, from a policymaker decision, trying to strike a balance between making sure that there's compliance with the probation order and particularly with the abstinence of substance use, and realizing that this is appropriately a burden on the probationer given the misconduct, and realizing that life happens to an individual, and the most perfect person does sometimes even forget to check in and miss a testing and have been abstaining from use. So are there other places that you do work in, other jurisdictions you do work in, where they've demonstrated a policy approach that recognizes that and accommodates for that in their testing procedures? given the fact that you may even have 3 days, like plus or minus 3 days based on the urine sample, which I think you said is the backbone of that forensic science.
It is the backbone, and yes, there's a lot of variability out there. Since it's not like federal mandated workplace testing where there's one big overriding umbrella. So there is a lot of variability, but I think the best standards are that your policy says we can basically test any tissue of your body at our decision at any time, and that the recommended follow-up should be with a matrix that adequately addresses the main analytes, drugs, alcohol, the main analytes of concern in the appropriate time period. But I would not write a policy or put something in there that would limit you to saying every time you miss a urine test for whatever reason, you're going to get a hair, because that may not be accurate. I'd like to give you all the ability to choose the most appropriate specimen and to collect that specimen in the most appropriate time period. So the kind of nebulous language, I think, is a better way to go.
And I know Ms. Nystrom has a question, so I'll wrap up and let me ask the question differently, which is, are you able to share with us other jurisdictions, either state or other boards, that have a plus or minus window on missing a check-in, so that they can do a follow-up test the following day? I'm just curious to know more about that.
What do you mean by share other clients' policies?
Yes, to the extent which they're publicly available and they're open to sharing without naming them. But I'm just curious if there are other jurisdictions that say, we understand that sometimes you may miss a check-in call or testing due to different circumstances. And when you do that, we will we want you to come in the next day, and the vault has the discretion to test the type of sample they need to test to be able to get the most accurate information available given a missed test.
Well, understand that as a third-party administrator, what we don't do is keep everybody's individual policies. We don't. We consult and corroborate to the extent that we can, but we don't have access to most of them. And what we do is limit ourselves to the specific, drug testing protocol. Now, what I do is answer questions when I'm asked them about what would I recommend as a follow-up test based on this, but the policy has to be written to allow that to happen. But we do what we are told to do, since we don't have that kind of therapeutic relationship with your participant.
Understood. Thank you, Dr. Ferguson.
Hope that made sense.
It did. Thanks.
Perfect. I see Ms. Nystrom. Oh, sorry.
Maybe I'll just add on. This is Jordan, and I agree fully with Dr. Ferguson. We ultimately administer the policy that the client has. We would be happy to talk through, though, if there's specific questions, not in this forum necessarily, but maybe in a different forum to kind of talk about different changes of policy we've seen that are publicly available and consult with you on that regard. I know there's one other question though.
I see. Yes, Ms. Nystrom, go ahead.
Hello, thank you, Mr. Oschlager and Dr. Ferguson. On the slide that shows the collection site network, I'm curious if there's any site like collection deserts in California. It appears that there are a number of sites for folks to use. I'm just curious if there's been some issues with North State California, Central Valley, some of I don't know, I guess maybe Imperial County or some of the farther portions of California that maybe don't have all the resources. And I'm just curious if there's any areas that you've identified in California where there's not necessarily the sites that we hope there would.
Yeah, there's not a specific area that pops to my mind for California. California, obviously, being that there, like you noted, some areas that have less population, so therefore there's less options. You know, this is our network is continually changing and adding because we're always looking for more networks, collection sites that meet the requirements that we can add. And we're also evaluating those sites to make sure they're providing, you know, consistent quality and compliant services. And so, yeah, if you ever see those examples where or you hear about a participant who's having difficulty getting a location or it's cumbersome, you know, we obviously work hand in hand with them to look for different options for them. But off the top of my head, I don't have a specific area that we have, but we're aware that there's certain, you can see pockets that there's not as many sites options as we'd like, which is something that our administrative team is constantly looking to fill in with.
And the reason Jordan's given that kind of an answer is because there are collection deserts everywhere. There, you know, you can look at rural areas and certainly expect them to do that, but in urban areas, in certain, you know, districts of urban areas, there are places that collection sites just don't work. There are demographic issues that are problematic. And the type of testing that we're doing doesn't make it any easier because if we do observe specimens, you have to have a same-sex observer. So you can have a collection site that may not have access to a same-sex observer. You can have a collection site that may not have a phlebotomist to draw blood for PEth. So it's a complicated issue, and that there are deserts. But Jordan's right. I mean, we got the industry standard layout of collection sites, and probably goes the industry a couple of times better because of the length of time we've been doing this and the amount of attention you have to put based on the type of testing that we're doing. But if something comes up, you just have to, you know, get in touch with us and see what we can find in that area. You can also maybe look at doing a different kind of test. If you don't have a phlebotomist to draw blood, you might consider a blood spot test for the same type of thing. In some cases, you can even think about virtual collection for oral fluid or nails or something like that. So there are a lot of options out there, but the sad truth is that, yeah, deserts exist.
Okay, that's helpful. That just gives us a little bit of insight into what you're looking at, what you're dealing with as well, and then try to make sure that we're working with folks the best we can. Thank you very much for your presentation, for your service.
Is there any other board member who has questions? I'm scrolling through slowly just to see if there are any hands up. Perfect. Ms. Moderator, can we open up public comment for the vault presentation?
Certainly. And we've opened up the WebEx Q&A feature to assist with public comment. If anyone has any comment on the presentation, you can look for the question mark icon in the lower right of your WebEx screen, or behind the 3-dot other options if you're on a mobile device. If you're a call-in user, you can raise your hand by pressing *3, and any attendee may raise their hand by clicking on the hand icon. Each speaker will have 2 minutes with a 30-second warning. Are there any questions on the presentation? And I do not see any requests for comment at this time. Shall I close the Q&A feature?
Yes, please, and thank you very much for your help.
Dr. Tate, this is Dr. Kasuga. I just wanted to announce that I am back in the meeting. I've been back since 10 a.m.
Perfect. Thank you and welcome. Just bringing it back to the board members. Any other questions on the vault presentation before we move on? Mr. Fu.
Thank you, Madam President. This is less of a question and more of a comment. And I wonder if, based on today's presentation, which if Dr. Phillips is open for a discussion in enforcement committee just to reflect on this presentation and with enforcement staff. If Dr. Phillips is open for it to be scheduled at a future enforcement committee meeting. Or Ms. Monterrubio is open to having that reflection session with us.
Perfect. I was going to say Dr. Phillips isn't here today, but maybe.
Hi, this is Sandra, Mrs. Montrubio. Yeah, I absolutely can put that on our agenda for our next enforcement committee meeting. Not a problem.
Thank you. And that's right. Dr. Phillips isn't here. And I kept seeing board staff, STEPH, and I, in my head, went to Dr. Phillips, not reading the staff part and pulling it out to see that's actually Ms. Chung. So apologies for calling out a member who isn't here.
Not a problem. Thank you for your comments, Mr. Fu. Any other board members? Okay, before we close out, thank you so much for coming and providing us with a lot of information. We appreciate it, and it looks like we'll be passing on this information to our enforcement committee. Thank you so much.
Thank you.
So it is 10:23 right now. Let's do a break till 10:35. Ms. Pruteau, can you please call the roll?
Kasuga.
Here.
Fu.
Here.
Barb Sheets.
Here.
Nystrom.
Here.
Rogers.
Here.
Tate.
Here.
Roll is complete.
Thank you, and quorum is established. We're going to jump into agenda item number 10. This is healthcare access and information presentation regarding workforce shortage. Let's see. Has the correct person been promoted to a panelist, Ms. Moderator?
Just one moment while I go ahead and get that fixed. And the name of the presenter, if you would remind me.
Last name is Crouch, M. Crouch.
All right. I'm not seeing. Let me refresh my screen, make sure that I've got everyone here.
Okay, I'm looking too.
Thank you so much. I know there had been some connection confusion with the link to the meeting.
Oh.
I hope that they got that figured out. I do not see anyone with the name Crouch logged in at this time.
Okay, let's give it another minute.
And attendee Karen Rizal, are you representing HCAI?
Hello,
Yes.
this is, can you hear me? This is Karen
Yes.
Rizel from HCI. I was
Oh, you are.
presenting on this topic, yes.
Wonderful. I will make you a panelist. It's going to mute you when I move you, but then you'll be able to mute and unmute yourself at will.
Thank you, Ms. Rizal. I didn't have the name change.
Okay, we see your video and there you go.
Okay, it looks like
Perfect.
it's working. Okay.
Great.
Great. Thank you very much, everyone, and for the opportunity to be here today. My name is Karen Rizel. I am with Department of Healthcare Access and Information, HCI Deputy Director with our Health Workforce Development Portfolio of Programs. And so I just wanted to spend a few minutes with you today talking about some of our behavioral health workforce initiatives. So go ahead and move to the next slide. So for those of you that may not be fully familiar with HCI, HCI is formerly known as OSHPD. transitioned to become HCI in 2021. And through that process, established, really kind of reinforced our mission and vision for the work that we do. And it's really about, as it's stated here, expanding equitable access to quality, affordable health care for all Californians, and through a variety of means, facilities, information, and the health workforce each community needs, which is what I'll be talking with you about today. On the next slide is just also, as I mentioned earlier, that OSHPD, who was established in 1978, we became a variety of different things happened in 2021. And in that process, we became the Department of Healthcare Access and Information to really better reflect the work that we've been given to do. On the next slide, you will see, so I want to talk a little bit about health workforce development and what we are all about, our purpose. As you can see here, we have three main objectives with our health workforce portfolio of programs. We want to support and increase the health workforce that serves medically underserved areas. We recognize that there's many shortages in the state, and we want to be finding and addressing those shortages. We also want to build a workforce that represents the California it serves through racial and language diversity. We have a broad and diverse state, and we want to build a workforce that represents the California that it's serving. And then finally, we want to be able to serve Medi-Cal members, to be able to impact access to healthcare. And through that, we do our work in three different main areas. One is we provide financial support to organizations expanding educational capacity, individuals to supporting individuals who want to pursue healthcare careers with their scholarship and loan repayment. And also we want to build the pipeline. So I will, in the next couple slides, kind of walk through some of those key areas and point out some of the work that we're doing around behavioral health. So if I can go to the next slide. So again, I'll focus in on, we have a broad array of programs, but today I'm going to dig a little bit deeper into the behavioral health workforce activities. So one of the things, as I mentioned on the next slide, that will show you is our Education Capacity Expansion Program. It's a long name for a set of programs that are around how do we build and train programs to support programs to train more. Right, we can fill in the blank in terms of what more is, but we know we need more. And so we have a couple of programs that we are looking at that expand the capacity. Psychiatric Education Capacity Expansion Program was established in 2019, but that awards programs doing two things: establishing or expanding psychiatric residencies, as well as establishing or expanding psychiatric mental health nurse practitioner training programs, as well as looking how we can support additional fellowships around addiction psychiatry, for example, or child or adolescent medicine. In our last round of awards, we were able to support 15 organizations, adding over 700 new psychiatric mental health nurse practitioner slots and 45 new psychiatric residency slots. For this year, we also recognize the need, so we need to build the social work workforce. And so we started a program to do that. And so we just awarded over $58 million this last year to support expanding or growing new programs at 22 schools, both bachelor's and master's level, adding over 800 new student slots. So this is an add to the amounts that training programs we're currently training. Then on the next slide, we also have a couple different programs that we're calling our Train New Trainers approach. And these are programs that are actually run from the University California Irvine School of Medicine that have the Train New Trainer approach is and in two areas. One is training that's really around training primary care providers to better be able to serve psychiatric and addiction needs that they're seeing in primary care practices. And so one of them is really around primary care psychiatry, and the other one is around training in education and addiction medicine. And so HCI funds the scholarships for these programs, which is they're about $15,500 a year. And so we have funding to be able to support fellowships and scholarships for students who are wanting to pursue this additional training. On the next slide, we also look at how do we expand the work that we're doing in some of our kind of more allied health professions, recognizing the important role that peer personnel play in our behavioral health workforce system. And so we've had an ongoing peer personnel training and placement program for many years. With additional funding that we've received, you can see that since 2021, we've been able to award 24 organizations to train almost 4,000 new peer personnel. The other thing that we're looking at is substance use disorder. How can we support organizations training and building substance use disorder workforce? And we just launched, actually we just recently announced, if you may have seen the press release, where we awarded organizations to do an apprenticeship approach, a really earn and learn approach to how to recruit and train new workforce to serve substance use disorder affected individuals. And then also the other area that we're looking at is how do we better train and support in serving justice and system involved youth with our behavioral health work. And so we're looking at a couple different things for that to be able to support not only increasing awareness about this population, but how do we incorporate this population into the workforce. On the next slide, I wanted to mention also, so one of the things that we were empowered to do with the funding that we received in 2021 was through the Children and Youth Behavioral Health Initiative, which was, as you know, a significant investment in California to transform the behavioral health system for children and youth. HCI received around $800 million of that to work on activities to support the behavioral health workforce. One of the things was almost half of these dollars, as you can see, was to develop a new role called the wellness coach. And we spent about a year in stakeholder engagement to really understanding the role that a wellness coach could play, but it was really intended to serve youth where they live, study, and work. And so they'll be working on building workforce of wellness coaches in schools and community settings. But it's intended to be a non-licensed kind of intermediary entry-level position into the behavioral health workforce for either an AA or a bachelor's level degree. And so it will, as we're working to develop the curriculum now, it will create that foundation and build that career kind of pathway such that if a wellness coach wants to pursue an advanced degree, a social degree, a psychology, advanced psychology degree, that then they will be well set up with training and education to be able to pursue higher level education and professions. So we're excited about this wellness coach role, and we will be standing up a process and training later on this year into 2024. Then on the next thing I wanted to talk about, as I mentioned, the second thing in our area of work was how do we support individuals to be able to enter the workforce, be supported while they're going to school, but also be able to serve in underserved areas with loan repayment and scholarship programs. I wanted to highlight here today, we have about, I think, 15 different programs that serve all types of healthcare providers. These are the ones that have the ability to support behavioral health professionals through our loan repayment programs. And I know with our licensed mental health services provider education program, which receives significant funding ongoing from licensing fees from the board. And I think this year we've received over $200,000 in licensing fees that we've been able to turn back around and award loan repayment to behavioral health providers serving in underserved areas and facilities. And so we are thankful and that we have this ongoing funding through the licensing fees. It really does make a difference to be able to support these programs and bring providers into your areas. But I also wanted to note that we have launched two new programs to support behavioral health professionals. One is our behavioral health scholarship program. We wanted to consolidate a lot of our opportunities for behavioral health students into one scholarship program. We just launched that this week, and we'll be having a public informational webinar at the end of the month. Encourage anyone to go to our website and register for that webinar if you or your organization would like to find out more. We also launched the Golden State Social Opportunities Scholarship Program that's funded from Mental Health Services Fund dollars to be able to support, again, behavioral health scholarships, especially for those professionals willing to serve in community-based organizations and nonprofits when they complete their schooling. Next, I wanted to go to the other thing that we did this year that was new to us is we were able to award over $117 million in grants to organizations, community-based organizations throughout California. One of the things we hear over and over again, and I'm sure you all know, is the behavioral health workforce crisis is real. The need is real. The need is great. And so what we want to do is support those organizations that are looking to recruit and retain their workforce to be able to better serve in their communities with the people that are in their communities. And so we were able to award over $117 million to over 130 organizations that provide these behavioral health services throughout California with a variety of tools to be able to enable them to recruit and retain the workforce that they need. And then next, as I mentioned earlier, one of the third pillars of our work is our pipeline work that we run through our Health Professions Career Opportunity Program. It is a statute that we have that broadly allows us to develop and support pipeline work. And we were able to award over almost 41 million in this last year to support 20 organizations serving over 32,000 students, including supporting those pursuing behavioral health careers. We will, in our next cycle that's opening up, we will be able to support with additional funding to support wraparound services to youth from the foster system, for justice system involved, to be able to really support with wraparound services and kind of apprenticeship opportunities. We'll also be supporting post-baccalaureate opportunities. So we continue to really expand this program. What we encourage with this program is the funding is what we look at as a way for regional and local organizations to reach into their communities to see what the needs are to build those pipelines, because we know that there's regional needs and regional partnerships, and our programs can support those organizations that are building those connections with students, with youth throughout the communities, and help mentor and support them as they want to pursue behavioral health careers. So we'll be opening up that application cycle, I think later in the summer in August. Our Health Careers Exploration Program is a long-standing program that supports kind of those short-term grants to support a conference or a workshop or those career exploration activities that your organization may want to host. And so we also encourage organizations to consider that as an option to build that awareness around behavioral health careers and encourage the interest in those supporting students who want to pursue. So then on the next slide, what I wanted to do is talk about two kind of activities that we have that also support behavioral health workforce. One is our Health Workforce Education and Training Council. It is a public body established in 2021 that is set to look at how to establish and develop graduate medical education and workforce training opportunities. So not only primary care, behavioral health, nursing, allied health, but it's really how do we support the broad workforce? How do we look together as a state to look at how do we build and develop the workforce and train the workforce that we need? And so one of the things that this council has been doing is actually from the beginning, the first topic that the council took up was behavioral health. And so one of the things it's been talking about since March of 2022 is what are the strategies, what are the innovative ideas what are the barriers that we're seeing? And we've been bringing in different folks to talk with the subject matter experts, representatives from education, to really talk about what some of the barriers are to building that workforce, but also what are some of the opportunities. What are the ways that California as HCI can use our dollars best to support building the behavioral health workforce. And so we were excited because there was if you go to the next slide, you'll see that I believe it's on this slide. Go ahead and move to the next slide. Is when we met with the Workforce Council at our last meeting in March. The council meets quarterly. They said these are the recommendations that we see for the state of California that we would like to see us focus on our activities, our funding. And so with that information, it helps kind of drive and think about the work that we're doing at HCI with the dollars that we receive to support the workforce, including supporting with scholarships, with stipends, to be able to prioritize students from underserved areas, to be able to bring in additional faculty. We recognize that faculty and clinical supervision are sometimes barriers to increase in the workforce. One of the things I didn't mention earlier with one of our programs also was our social work stipends program. We just recently reinstated our program to be able to provide stipends and fellowships to social work graduate students to be able to help them better able to complete their degrees and get licensing. But you can see it looking at broadly. How do we support pathway programs? How do we support pipeline? What are the things we can do to accelerate the training? One of the things with our social work education capacity expansion program was we were able to fund programs that do these accelerated programs, what's called a 4+1. But we're looking at other ways we can accelerate the training of the behavioral health workforce that we need. And then next I wanted to jump into our the other area that we have that was established in 2021. A lot was established in 2021 was our new health workforce research data center. And that allowed us to really, again, is to be able to work with a variety of organizations, especially such as yours, the licensing boards, to be able to collect information. And so you may have seen that we've been fortunate to have such a strong partner with DCA, the licensing boards, to really build this survey so that when licensees come in to renew their license or obtain their license, that there's a set of questions that are asked. And we're able to use that information to be able to better understand the workforce. Because with this information and other information we can gather from the education system as we're working on kind of demand issues, we really want to be able to say, where are the needs? Where is the workforce now? Where do we need to be focusing our energies? And so this data that we're collecting from the different licensing boards at renewal is valuable information and essential information to help us be able to better, project back to the state as to what the needs are and what we can be doing. And so I just wanted to share on the next couple slides. With this data, I wanted to show some of the information that we're starting to see based upon this data that we're collecting. And one of the things we do is an annual report to the legislature of our work with the Research Data Center, but we will also be putting out data reports and dashboards and information out to our website regularly so that the individual stakeholders, organizations will be able to see and the information that we're collecting, and hopefully it's useful to all of us as we're building our workforce. So for example, we looked at to see where are professionals, where are they serving? And so we look just broadly, you know, that the behavioral health workforce is maldistributed, that we know that there's pockets. And I know I heard earlier talking about kind of deserts in terms of some of these testing, but there's deserts as well in terms of the workforce, and where we can see in the valley and in the inland empire where we have this, you know, a shortage of a variety of different behavioral health workforce professionals. On the next slide, then, we're also able to take a look at where are people in their journey in their profession, and we can see that in many of professions that we see it, you know, the aging of the workforce, which means what we need to be bringing in and building that pipeline, right, and training a new workforce. And so it helps us understand where the issues are and to be able to focus activities. Finally, I think the last slide on the behavioral health workforce summary is just showing also the demographics. As I mentioned earlier, one of our goals is to be able to build a workforce that represents and serves California. So we need to be able to understand what kind of a workforce we have now, where the gaps are, where some of the opportunities are. And so the information that we're gathering from the licensing board, from all of you, is invaluable in helping provide this kind of snapshot and visual of what the behavioral health workforce looks like. That is what I had today. I just encourage any of you to anytime you want to have questions, to please follow us on HCI, on a variety of different social media opportunities, as well as on the next page. If you are not already, if you're not signed up for our monthly workforce programs update, please feel free to sign up. We have a monthly announcement, but we also have regular news releases and of new programs that we're putting out. But it's the best way to stay connected with us and learn more about the different programs that we're offering that are hopefully serving you in the work that you're doing. Thank you.
Thank you, Ms. Frizzell. What an amazing presentation with a lot of information packed in there. HCI is doing an amazing amount of work. I'd like to open it up to the board for any questions or comments at this time. I'm scrolling slowly. Oh, I see. Oh, Ms. Nystrom. Go ahead.
Hi, thank you so much for your presentation today. Just a couple follow-up questions. One, with the grants and the awards that HCI is, as you mentioned, you know, so much is done on the local level. So then with the awards and the grants, is HCI really tracking, you know, to ensure, and do you have goals that you're tracking to ensure that the funding that's getting out to the local communities is actually, you know, recruiting individuals for the healthcare industry?
Yes, I mean, and that's one of the things that our program is doing, and we'll also be having more. We're working on more of that information to be displaying publicly later. But we, you know, always evaluating our program, being able to provide of input, you know, back to say this is what we're seeing in our communities. One of the things, for example, we do see very clearly that loan repayment programs work, and loan repayment programs increase retention, increase the ability of rural and underserved areas to do the work that they need to do, as an example. But yes, we go back and collect that information in terms of you know, the impact that our programs are making.
Okay, I appreciate that. And then on the data set, when we talk about geographic kind of areas that are underserved by healthcare, I think your graph showed Central California, San Joaquin Valley, and then also the Inland Empire, and then there may have been a little bit in North State. You know, there's pockets all around California, but how are you partnering with like UCSF and the Fresno Prime program, and then maybe some of the I think UC Irvine or UC Riverside might have similar programs as well. If you could just speak to that a little bit, that'd be great.
Yes, one of the things that we, with through some of our pipeline programs, for example, we work with organizations in a variety of ways. Our programs can fund training programs, right, in these areas to expand the work that they're doing through our pipeline programs, being able to support the work that regional organizations are doing to build that workforce in their area. So it depends. We have a lot of connections with a variety of UC, CSUs, community colleges, community-based organizations throughout the state to be able to support opportunities, whether it's pipeline, recruitment, retention.
Okay, wonderful. Thank you for that information, for the update, and for your work.
Dr. Kasuga, I see your hand is up as well.
Thank you. I have a question with regards to workforce committee that provides the recommendation. Is the report, is that available to the public?
Yes, the Workforce Council, Workforce Education and Training Council is a public body, and the meetings are public, and all of the activities are public. So we encourage public participation to attend these meetings and all of our minutes. We don't have a report yet on this, on the recommendations. One of the things that will happen is at the March meeting, the council put together these recommendations. Then we will be working with the council as we look at implementing them, and we'll be continuing to update the council with our updates at each meeting. And our next meeting is June 7th, I believe.
Got it. And then once implemented, if the recommendations are implemented, how are the programs going to be evaluated?
As I mentioned earlier, through our evaluation process, one of these recommendations will be used to support our either developing a new program that HCI would develop, or through our expanding and supporting our existing programs. And so we always and continually evaluate our programs as we are operating them.
Another thing too that I'd like to know for our stakeholders, the licensed mental health loan repayment is one of the programs that I think our stakeholders are interested in applying. Can you provide us with the application period for that?
I believe it's open now, but don't quote me on that. If you go to our website, which I believe is in these slides, if you have them, you can go to our page that has all of our loan repayment and scholarship programs and get all of the details on any of them.
Thank you so much.
And just also, we usually run them, annually, each of these programs. But one of the things that we've been trying to do with some of our programs is we run them and have them open for a little bit longer period of time than we normally would, and then throughout the process, we're able to make kind of monthly awards and of individuals, so that people will have a sense of that they've been awarded, and that even instead of waiting like 3 months, we'll make kind of like monthly awards, so that we're trying to be kind of more real time in terms of some of the awards we're making.
That just reminds me, I think that one of the things that have come up with regards to this opportunities and awards and grants that are available, scholarships that are available to mental health practitioners is the lack of promotion that these are going on. I don't think it's advertised or kind of like is kind of like well marketed. One of the things that we've done before is I guess highlight some of the winners or some of the people that were granted who got the scholarship in our newsletter, and maybe we can have another one that kind of like talks about the application period. That way we can promote it to potential participants or potential stakeholders that are interested in applying for the scholarships and the grants.
Thank you. Absolutely. We'd love that. One of the things we do know is we're working very hard to get the word out as much as we can about all of our programs, and we recognize that there's still more work to do. We've been doing more press releases. We have webinars when we open up a new cycle of our programs. And so, but we absolutely are willing to continue to collaborate on how we can work with you to share success stories and more about our programs, and appreciate your interest in doing that.
Thank you.
Dr. Rogers.
Thank you, Dr. Tate. Ms. Rizel, thank you so much for your presentation today. It was really, really informative. I have questions related to two specific areas. The first is the Education Capacity Expansion Program, and then the second is related to the behavioral health workforce. So I'll start with the Education Capacity Expansion Programs. When you were talking about the various disciplines, I noticed that there were lots of program expansion for psychiatrists, nurse practitioners, social work programs, primary care, peer personnel, and wellness coaches. I didn't see anything listed about psychologists specifically. So I was wondering if HCI has any initiatives for expanding programs for psychologists, and if not, does HCI have a commitment to this?
You are absolutely right that you saw that. And one of the things we've been looking at is what are the different other professions that we need to start building programs for. We have received, we received some designated funding for social work, so for psychiatry, and so we appreciate that, because we have been looking at, so what are the other kind of educational capacity expansion disciplines that we need to grow. And so do appreciate that, because that is we've been hearing about psychologists and thinking about what we can do to support that.
Okay, fantastic. And as you have more information about that, would you be able to relay that to us at the board, just so we could be apprised of what's happening with that at HCI?
Absolutely.
Okay, fantastic. And then my second question is related to the behavioral health workforce. If someone could scroll to the summary page, it's page 63 in the combined packet. And I think it's slide 1 of 3 in the presentation. Okay, great. Thank you so much. I noticed on this slide where it looks at the different disciplines, I see clinical social workers, marriage and family therapists, professional clinical counselors, and educational psychologists. I was just wondering if you could speak a little bit about the educational psychologist piece. Is that just a subsegment of all psychologists? I'm just trying to figure out if the entirety of our profession is represented in these graphs.
You know what? That's a good question, and I don't know that I have the exact answer for you there, but I can certainly get that. I do also encourage to dig deeper into this. I believe I put a link on the website to our report. And so if you want to go to the report where we dig deeper into each of the categories, this was just kind of a snapshot of some of the high level information. But you can see in our report where we talk more fully about, you know, what's represented in each of these areas in the report itself.
Okay, perfect. Thank you so much, Ms. Rizel. I really appreciate it.
You're welcome.
Any other board oh, Dr. Harp Sheets, I see you.
Thank you. I was just going to clarify what I think we might be seeing on educational psychologists is that category of licensure, licensed through the Board of Behavioral Science versus psychologists licensed through our board. That would be my guess. I just wanted to add that.
Thank you, Dr. Harbsheets.
And I also will say that the information that we kind of shared with you is somewhat preliminary. I mean, it's as we're gathering it because we haven't fully collected all of the data from all the licensing boards yet, since it's kind of new. So hopefully, like in the next 6 months or more, we'll start to have a more full set of data from all of the different licensing boards.
Thank you. Any other board comment before I open it up for public comment? Okay. Ms. Moderator, can you please open up public comment for agenda item number 10?
Absolutely. So we've opened up the WebEx Q&A feature to facilitate public comment. If you've got a comment, you can look for the question mark icon, typically in the lower right corner of your WebEx screen, and I'm not seeing it, so let me hit that again. Thank you. And if you'd like to hit that and then type the word comment in the text box and click send, the other option is you can raise your hand by clicking on the hand icon, and any call-in users can press *3 to raise their hands. So at this point, we do have a raised hand from, let me see, one moment. Yes, so let's see, some Melody Schaefer. I'm going to send you a request to unmute your microphone, and you'll have 2 minutes with a 30-second warning. And you're
Your
unmuted.
presentation. Thank you for your presentation. My name is Dr. Melody Schaefer. I'm chair of the board of the California Psychology Internship Council and chair of Division II Education and Training of California Psychological Association. Is there any psychologist serving on the HCAI board or meetings?
There are no psychologists on our current Workforce Education and Training Council. It's a public body with has governor legislative appointees, and so if there are folks interested in participating, it would be going through that process.
Thank you.
We have a behavioral health representative, but no psychologists.
That's what I thought. Before HCAI developed, it was OSHPD, and on OSHPD, I was part of that group, and I was the only psychologist going, unfortunately. But during that time, I saw some of what I'm concerned about might be happening now, which was the elimination of psychologists having funds. In 2008, I worked with OSHPD to open up it to psychologists, which resulted in $8 million of grant money over many years. When I went back to that board in 2012, the social workers were putting forth that we didn't need psychologists, and they were going to eliminate funds for stipends then. And happily, I was able to do a presentation that resulted in $2 million of funds. Now, what I'm hearing today, if I understood correctly, and please correct me if I'm wrong, is that there is a social work stipend program, but I'm not hearing that there's one for psychologists, and that concerns me. Could you help me understand how that is happening, if that is true, that psychology folks are not getting that same stipend?
30 seconds.
No, thank you for your question. And yes, Currently the stipend program is supporting social work. And again, what we're looking at is what are some of the opportunities that we have. Some of the funding that we had was specifically targeted in certain areas, that we received in the state budget. But we are looking at how we can expand the ability to serve a variety of different behavioral health professions.
And quickly, who do I contact to find out how we get a psychologist in your committee or board to represent our profession?
You can, I can send you you can contact me. I'm not sure if my contact information is here, but I think we
No,
can
it's
get it
not.
to you. But you can send it to the information on the slide set. We can follow up with you to direct you to it would be through the legislative and governor appointees offices.
Yes, and I want to just second what was said earlier, is it's very difficult for people to find out about this program in the psychology field. I've put forth things from your last presentation. Even folks going onto the website can't get easy access, and these are people that are heads of doctoral programs trying to get it for their students to be able to apply for. So any information sheet that could be easily disseminated would be greatly appreciated. Thank you for your help.
No, thank you. And I also appreciate the feedback, because one of the things we're trying to do is to make things easier and more visible. And so if people are having challenges, we certainly want to hear about it.
And our next question is from Shanesha Sorensen. I'm going to be going ahead and sending you a request to unmute your microphone, and you'll have 2 minutes with a 30-second warning. And you're unmuted.
Presentation. I had a question of, does HCAI work with corrections and county jails to bolster and retain the mental health workforce there?
Thank you for the question. In some of the programs allow the capacity to serve in those areas, and some don't. It just depends on some of the statutory requirements for each. And so what we do have a tool on our website where people can go in and find out a little bit more, but it just depends on the program.
Okay, and our next question is from Dr. Elizabeth Winkleman. And Elizabeth, I'm going to send you a request to unmute your microphone so that you can ask your question. One moment. And you're unmuted.
Thank you. This is Dr. Elizabeth Winkleman with the California Psychological Association. I wanted to thank you for the presentation, and also we do appreciate psychologists being included in the loan repayment program. However, I wanted to echo some of the comments and emphasize the importance of the comments and questions of Dr. Rogers and Dr. Schaefer. To most importantly, the educational stipend issue, and really looking to get psychologists included in that. We need to facilitate entry into the workforce for psychologists as well, and also to include us in the data. Licensed educational psychologists are not psychologists, they are master's level providers. So I realize you mentioned that these were not complete data, but just moving forward to make sure to include psychologists in those data that are collected. I do think it's a great idea to have a psychologist added to the group. And I'm glad Dr. Schaefer may be able to be proposed to join the group that's the committee. And then finally, I wanted to mention that California Psychological Association has also been interacting with HCI about scope issues to make sure that the allied health professional workforce that's being developed is properly trained and qualified and not acting within the scope of practice of a licensed mental health provider.
30 seconds.
Okay, I'm almost done. Not acting within the scope of practice of a licensed mental health provider without appropriate training. because we want to make sure that people that are in need get the high quality care. So thank you.
Thank you for all of that, and we appreciate the ongoing partnership and collaboration and input as we're developing our programs. And again, I just want to say about the licensing boards, we're in process. So we're collecting from, I think, 18 different licensing boards, and so we'll soon see a fuller set of information for each of the different disciplines in each licensing board.
Thank you. And our next request for comment is from Jennifer Alley. Jennifer, I'm going to send you a request to unmute your microphone, and you'll have 2 minutes with a 30-second warning. You're unmuted.
Good morning. This is Jennifer Alley with CPA, and I'd like to thank you for your presentation today, and just kind of wondered if you could elaborate a little bit more on this year's state budget and changes that were made to allocations that did include educational stipends, scholarship stipends and loan repayments for psychologists, MFTs, and licensed professional clinical counselors and social workers. And if you could provide any insight on why funding this year was delayed for those provider groups, including psychologists, and only limited to social workers, because I think it isn't representative of the provider base that could be utilized to address the behavioral health crisis in the state. And I think that all behavioral health providers, including psychologists, bring a unique skill set to the table, and different people may respond differently to different treatment approaches. And so if you could kind of explain why social workers seem to be highlighted in this year's funding initiatives, and when could we expect last year's funding to be utilized and distributed for psychologists. And I think that we look forward to seeing the data. It appears the slides now only include the provider
30
types listed
seconds.
under the Board of Behavioral Sciences. And so if you could please include psychologists in future presentations, I think that would be appreciated, as we are do provide a unique and critical need to Californians. Thank you.
Thank you, and thank you again for the input. Yes, I will just share with the budget. I think, as many of you know, in the January budget, several of our the funding that was appropriated to HCI was proposed to be delayed into 24-25, and that included some work to support some of the other disciplines, such as psychologists. As we understand it, the May revise continues that delay of those funds, and so some of the funds were proposed to be continued, and some were proposed to be delayed, and that included the support, as you mentioned, for the psychologist workforce. So what we would expect is that would be then restored in 24-25 budget.
And this is the moderator. I do not see any other requests for comment. Shall I close the public comment feature?
Yes, thank you so much.
You're welcome.
Thank you again, Ms. Rozelle. I'm just going to open it up briefly and see if there's any last minute board comment. Don't think I'm seeing any, but I'm scrolling slowly. Oh, Ms. Sorick.
Hi, thank you very much for coming and presenting to our board today. Typically in August, the board gets an update on the fiscal health of the loan repayment program and how that fund is doing. I'm wondering if, just piggybacking on the public comment and the budget situation, I'm wondering if that information on the other programs, not just the loan repayment program, but the other programs as well, can be added on to that update presentation for our August meeting. And I can double back with you after the meeting.
Absolutely. Glad to present whenever you would like.
Perfect. Thank you so much.
Thanks again, Ms. Rizal, for your presentation. I hope you have a great afternoon.
Thank you. Thank you for the opportunity.
So before I move forward, I just wanted to let everyone know that I'm planning on lunch around 12 noon and looking at 45 minutes. So if you need to make plans, now may be the time to do so. We're going to jump backwards to agenda item number 5. This was the discussion and possible approval of the board meeting minutes for April 7th, 2023. We did not have a full quorum. So I'm going to have to open up this item again. And if the board has comments or a motion, that would be amazing.
This is Dr. Harpsheets. I will make the motion that we approve the April 7th, 2023 board meeting minutes.
I second it. This is Dr. Kasuga.
Perfect. And so we have a motion and a second. Ms. Moderator, can you please open up public comment?
Certainly, we've opened up the WebEx Q&A to facilitate public comment. If anyone has a comment concerning the minutes and the motion, you can look for the question mark icon, click that, type the word comment in the text box and click send, or anyone may simply raise their hand by clicking on the hand icon, and calling users can press *3 to raise their hand. Are there any comments on the minutes? And I do not see any requests for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
This item is coming back to the board. We have a motion and a second. Is there any other board comment before we call the roll? Seeing none, Ms. Berteau, can you please call the roll?
Kasuga.
Aye.
Fu.
Aye.
Harpsheets.
Aye.
Nystrom is abstaining, correct?
Correct.
Correct.
Thank you. Rogers.
Aye.
Tate.
Aye.
Thank you.
Thank you. Motion passes. And we're moving on to agenda item number 11. This is review and consider amendments to the Board Administrative Procedures Manual. Ms. Sorick, please.
Or good morning again, board members and members of the public that have called in. Included in the meeting materials are amendments to the Board Administrative Procedures Manual. And I'm thinking this is probably going to be a fairly quick item. The only changes to the Administrative Procedure Manual that have been made are in highlighted. And that is on the committees of the board. So in the combined packet is going to be on page 86. You'll find that the inactive committees are committees where the work of the committees have completed at this time and can be moved back up to the active committees at any point. But the highlights and the underline are the major changes there, and I'm happy to entertain any questions you may have. And Mr. Gage is also available to make any changes to the draft if need be.
Any board comment? Questions for Ms. Sorick? A motion?
Oh, and Ms. Ng just pointed out on page 9, we have a item about the removal of the board members. So that might be something else you might want to consider removing.
Thank you, Ms. Sorick and Ms. Ng. Any board member comment? I'm not seeing any hands. Does that mean there's a possible motion in someone's mind?
This is say Ron Fu. So moved.
Thank you.
This is Nystrom. I'll second.
Thank you. We have a motion and a second.
This
there a
is, I'm sorry to interrupt. Member Fu, can you please clarify what the motion is for? I think with Ms. Sorick mentioned the changes to the committees. With respect to page 11 and the first paragraph under removal of board members, I think the suggestion by Ms. Sorick was to remove the first paragraph under the title board policy. Is that part of your motion to go ahead and strike that section?
That's correct. It's to I apologize. I was using a shorthand. It's to remove and approve the draft of the Administrative Procedural Manual as amended with the executive officer's recommendations.
Perfect. Thank you.
And Ms. Nystrom, does your second still?
Yes, my second still.
Perfect. Thank you. I'm seeing no questions from board members. Ms. Moderator, can you please open up public comment?
Certainly, we've opened up the WebEx Q&A to facilitate public comment. If anyone has a comment on the document or the changes, you can look for the question mark icon, type the word comment in the text box and click send, or anyone may raise their hand by clicking on the hand icon, and our call-in users can press *3 to raise their hand. Each speaker will have 2 minutes. And I do not see any requests for comment. Shall I close the public comment feature?
Yes, please, and thank you.
You're welcome.
So bringing it back to the board, there is a motion by Mr. Fu, a second by Ms. Nystrom. Any other board comment before Ms. Pruteau calls the roll? Ms. Pruteau, can you please call the roll?
Kasuga.
Aye.
Fu.
Aye.
Harp-Sheets.
Aye.
Nystrom.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you.
Thank you, and motion passes. Agenda item number 12 is the budget report. Mr. Burke.
Good morning, board members. I have an update, some updated numbers as to what's in the memo. So I'm going to present those now. The board has collected approximately 4.753 million and is projected to collect approximately 5.7 million in revenue. Board staff will continue to monitor revenue with the budget office monthly. As for expenditure for this fiscal year, the board is projected to expend 7.113 million of its budgeted appropriation of 7.919 million, leaving a balance of approximately $806,000. As you know, due to our budget situation, we're reviewing costs very closely. But that's the projection we're anticipating at this time. That concludes my budget update. Are there any questions?
Does any board member have questions for Mr. Burke? Mr. Fu.
Thank you, Madam President. Hi, Mr. Burke. I'm curious, have we received any guidance from DCA with regard to planning for next year's budget yet?
Yes, we're in sort of constant communication with the budget office regarding our current expenditures and what we're projected to do for the next year. There have been no specific.
Let me be more specific.
Okay.
Are any of the proposed trigger cuts going to be affecting the boards, specifically our board? as proposed in
As
the
of
new?
right now, we haven't been notified of any cuts or impacts to employees or the program as of right now.
That's really helpful, Ms. Sorick. And so it sounds like then we can continue to move forward with some of our other budget related items to address the structural deficit that Mr. Burke has brought up. Is that correct?
Correct. And I know we have Miss Munoz who is going to be promoted to panelist, and from the department, she should be able to speak a little bit more to the overall budget and its impact to the board. So I would invite Miss Munoz to add anything that she would like to our conversation thus far.
Yes, hi, this is Karen Munoz, DCA Budget Manager. I just wanted to just add the question regarding any potential budget cuts for the future. The Budget Office has not received any communication from Finance or from the administration as of now, so any further response, I don't want to speak prematurely on that. So like Antoinette said, we don't have any direction yet on any future cuts or anything like that. So we just continue business as normal. As we're related to next year's budget, we do have a governor's budget in place for next year, 23-24. We will be basing our appropriation on that and the expenses that the board makes. There will be some additional adjustments to that as we move into the fiscal year. So as we move into 23-24, there should be some minor adjustments to that appropriation as it relates to employee comp adjustments and retirement adjustments. But I don't see any other adjustments to next year's budget at this time. We don't have any other information to provide.
Thank you. Appreciate it, Ms. Munoz. Thank you, Mr. Burke, and thank you, Ms. Sorick as well.
Any other board comment on this item, the budget report?
Actually, I have one more question, Madam President. Is that okay?
Go ahead, of course.
Sorry, Mr. Burke, I've noticed that in the last couple, since our last budget report, that the reversion has been trending upward. I think we were, this could be bad memory, but I think we were in the 300s when we first learned about the reversion. Then we were in the 400s, and now it looks like we're approximately at 685,000. So I'm curious if there is any insight to why the reversion seems to be increasing, and also if that's just my made up memory. I really appreciate you saying so. Thank you.
No, I mean, it's always a fluid number because contracts are always assumed to be expended to the full contracted amount, and then of course the contract runs out, or we haven't used all the money on it, so that would increase the reversion. We also have had various vacancies for a while, which obviously then, we assume if someone leaves and we don't replace them for 5 months, that's a salary, a saving for us. Karen is, I think, still here, so she could talk a bit more to that, but I think I have answered your question.
Yeah, this is Karen. Jonathan is correct. If you see a trend of your reversions going up throughout the year, that is normal. When we look at your quarter one of the fiscal year, we might be projecting to full budget because we are not anticipating, we are not sure of what to project of cost savings at that point. Then as we move into quarter two or quarter three, we're looking at your projections and identifying some savings. But as we look at fiscal, quarter three, and we're looking more towards where we're going to end at the end of the fiscal year, we have a better idea of what contracts could be liquidated, what savings we can find there, as well as unanticipated salary savings. So if a position becomes vacant, we might have been projecting for it to be filled at one point in the year, and now we're projecting it to be filled at a later time.
Thank you both. That's really helpful.
I do not see any other board members' hands up. Ms. Moderator, can you please open up public comment for the budget report?
Absolutely. And we've opened up the WebEx Q&A to facilitate public comment. If anyone has a question or comment on the budget report, you can look for the question mark icon, type the word comment and click send, or anyone may raise their hand to ask to speak, and by clicking on the hand icon, and our calling users can press *3 to raise their hand, and each speaker will have 2 minutes with a 30-second warning. Any comments on the budget report? And we do have a request for comment from Ronald E. Salem. Ronald, I'm going to send you a request to unmute your microphone. You'll have 2 minutes with a 30-second warning. And Ronald, did you see a pop-up come up on your screen? There you go, you're unmuted.
That was stated or a comment that was made at the very beginning of the BOP session, which was that attendance for 3 hours, I can claim 6 hours of CE credit. Is that correct?
Hi, this is Lizelle. So yeah, if you stay for the meeting runs for more than 3 hours, you'll get credit for 6. And then
Thank you.
for less than 3 hours, it's hour by hour.
Thank you.
You're welcome.
And I do not see any other requests for comment. Shall I close the public comment feature?
Thank you so much. And thank you, Ms. McCochran, for jumping in there. I appreciate that. So the budget report was just an information only item. So we are going to move on to agenda item number 13, Organization Improvement Office, Internal Process Improvement Review of Licensing, Central Services, and Enforcement Units, Status and Improvements Identified. Mr. Burke, please.
Thank you. Good morning. Again, this item is a follow-up from the February board meeting when I gave the full presentation on the OIO process. At that time, a question came up regarding specific cost savings that can be attributed to some of the various changes that have been made. And I've been looking into that, and I do have some to present for licensing. Enforcement, we're still gathering some of that data, and I can present it to you at a later time, possibly during a budget update, just on how processes, we've reduced the time it takes to do certain processes with efficiencies identified during the OIO. And because of that, it's less staff time. We know how much staff time is worth through salary, and based on that, we can attribute an overall dollar value. So, for instance, the initial license application for an exam for a psychologist, it's performed approximately 1,400 times per year. It used to take us, according to the OIO mapping, about 172 minutes of staff time. That was reduced by 10 minutes. So that's a total efficiency hours of about 233 a year, which it all translates to a saving of $15,500. So that's how much these efficiencies have reduced that. Request to take the CPLEE, our Law and Ethics exam. It's performed about 959 times per year. It used to take us 80 minutes of staff time. Now it's 73 minutes of staff time, which is about, it's not quite 73, it's more like 72. So efficiencies found is 8 minutes. So that's a saving of $8,000 approximately. And the initial license application for registered psychological associates, we do this 987 times per year. It was 304 minutes of staff time. Now it's 292. So that's 13 minutes per time that it's processed. This is a $13,600 saving. And then the notification to add or change a supervisor, we do 547 of these a year. Previously, it was 214 minutes of staff time. Now it's 199 for a 15-minute efficiency for each time, which is $9,000. So those are the 4 that I've been able to calculate, and I want to thank the budget office. They helped me make sure that my formulas were correct, and also to the licensing unit for making these efficiencies in the first place, but also to walking me through them so I was able to key in the numbers properly. And I'll be able to do this with enforcement and central services once I've been able to calculate them. But like I said, this was an informational only item. It's a follow-up to a question that was asked by some board members in February. Are there any questions?
Thank you, Mr. Burke. Do any board members have questions regarding this item? Ms. Nystrom.
I'm more of a comment. Mr. Burke, thank you for taking the time to break that down and to reflect the savings and that the efficiencies and the changes are actually beneficial, and to be able to break that down, show that to us is very helpful. So thank you.
Dr. Harpsheets.
Thank you, Mr. Burke. That was really useful information. Could you, since I didn't write them down, do you have like a total of minutes saved and dollars saved that you have calculated?
I calculated the dollars, not the minutes, but I can do the minutes quickly now. These 4 processes process improvements annually. If you total up all of the numbers I gave, and forgive me, I was kind of reading approximate. It's easier to say $9,000 than $9,083.
That's
$9,083, but the total I have is $46,167.
Okay, and does that
Annually.
for the, I don't know if you have the licensing section budget, you might not have that with you, but I'm just wondering how that as a percentage of the overall budget, how that compares.
That I don't have, I'm afraid. I was looking, I wasn't looking at I really was just looking at the specific savings attributed to each.
I'm kind of wondering if that may represent sort of a half of a person in a sense, the money wise. I don't know. I mean, I'm just throwing that out as a guess, but it sounds really valuable, that process, to have gone through that and to look at the impact overall, especially when we're concerned about licensing processing times. So thank you. It's really helpful to break it down that way for us.
No problem. It was helpful for us too. The OIO it's been a useful process, for sure. So thank you.
Any other board members with questions or comments for Mr. Burke? I'm not seeing any hands. Ms. Moderator, can you please open up public comment for agenda item number 13?
Certainly. And we've opened up the WebEx Q&A to facilitate public comment. If anyone has any comment on the savings report, you can look for the question mark icon and then type the word comment in the text box and click send, or you can raise your hand by clicking on the hand icon, and our call-in users can press *3 to raise their hand. And each commenter will have 2 minutes. And I do not see any requests for comment. Shall I close the public comment feature?
Yes, please, and I appreciate that.
Thank you.
So we're 10 minutes early, but I don't think anyone will mind. So we'll take our lunch break now, and we will reconvene at 12:45. And Ms. Bruteau, can you please call the roll?
Welcome back. Kasuga.
Here.
Fu.
Hi.
Harb Sheets.
Here.
Nystrom.
Here.
Rogers.
Here.
Tate.
Here.
Roll is complete.
Thank you. Quorum is established. And we're just going to dive into agenda item number 14. This is the licensing report and the update on short-term and long-term plan to address the licensing timeframes. And I believe that for the licensing report, it's going to be Ms. Zhang.
Yes. Good afternoon, board members. Under Breeze update, we have as part of the board's Paperlike goal to implement courtesy email notification, also known as CEN. The CEN will replace some of the paper mail that the board sends out to licensee, registrants, and applicants. In other instances, the CEN will be an additional communication tool to our licensee, registrants, and applicants. So that's under Breeze update. Our first CEN, which is generated to an applicant when the application for licensure as a psychologist is expired, was implemented in October 2022. We recently configured the CEN for approved complete retake application in February 2023. And moving forward, the board plans to configure a CEN to notify psychologists and psychological associates when their license or registration becomes available for renewal. Moving on to attachment A, we have the licensee population report. As of April 26, 2023, we have a total of 22,618 licensed psychologists, and that includes 20,174 psychologists in current status and 2,444 psychologists in inactive status. I want to highlight the number that we have under the retired license status, which is the license status that recently became available as of 1/1/2023. As of April 26, 2023, we have 103 licensee and retired status. That is a great jump in comparison to earlier this year. We had 11 retired license status recorded on January 11, 2023. And in attachment A, we also include the data for the different registration status for registered psychological associates. Then on attachment B, it is the application workload report. It shows the statistics for approved and current open application from October 2022 through March 2023 for both psychologists and psychological associates. On attachment C, it provides the number of new application and notification received in the last 12-month period. In comparison to the same 12-month period in 2020 and 2021, there is an increase of 113 psychologist application, 191 psychological associates application, and 268 notification. And then on attachment D, it provides a 6-month overview of average application processing timeframe and business days. The processing timeframes are available and updated on the board's website approximately every 2 weeks. The monthly average application processing timeframes provided on attachment D are based on the first set of data collected for that month. Looking at the data for psychologists and psychological associates application and requests, the application processing timeframes have been pretty static in the last few months. However, for psychological associates, the processing timeframe show a noticeable decrease when comparing December 2022 data with the most recent data of April 2023. That will conclude my portion of the licensing reports, and I will hand the floor to Ms. Chung on the presentation on the update on short-term and long-term plan to address licensing timeframes.
Thank you, Ms. Song. I appreciate your report. Good afternoon, board members. At the 2022 August board meeting, I presented the short-term and long-term solutions to address the application backlogs happened at that time. Today, I'm going to provide a brief history and the contributing factors as a recap, and briefly talking about where we are today. So on this slide, you will see the background contributing factors. So there are a few here that I want to highlight. So the first one is the fund situation. In 2020, we were notified by budget that we need to right size our budget, and this led to the implementation of a series of cost savings measures. One of the measures was to terminate 2 temporary staff that assisted with the psychological associate applications in 2020. Staff at that time anticipated the potential impact in processing applications with reduced staffing. We immediately submitted a budget change proposal to request for additional staffing, but it didn't go very far because there was no money to support the request at that time. And the second contributing factor would be vacancy. Then there was also vacancy in the unit in different times in year 2020 and 2021. Vacancy directly impacts processing times. So assuming the number of applications doesn't change, but with less staff to process, the time that it needs to process will definitely go up. At that time, we also lost one of our licensing technician positions to help with administrative tasks. And processing times also can vary depending on a few factors, such as how many applications we receive at that time, the quality of application, and staffing impact and vacancy rates. So on the next slide, which I'm going to go to spend a little bit more time here. So this is a graph giving you a visual showing you the relationship and fluctuation of processing time and staffing vacancy rates for the last few years. So the bars represent the business days for processing and visa averages. And then the line represent the number of staff for that year. So before the fund becomes an issue in 2019, we had a total of 7 licensing analysts reviewing and processing applications with the help of 2 licensing technicians assisting with the administrative duties. The average processing times at that time were 27 business days for psychologist applications, 6 for psychological associate, and 17 for registered psychologist. But that category has been eliminated at a later time. So when we were dealing with the fund situation in 2020, we lost 4 positions, including 3 analysts and 1 technician, and actually had a total of 4 licensing analysts reviewing and processing application, and 1 licensing technician helping with administrative duties. And we also have one vacancy at different times of the year throughout 2021, 2020, which means we were at 3 licensing analysts at times. The time it took to review applications went up as there were much less staff to process the same number of applications, if not more. As you can tell that it takes some time to realize cost savings, but in the end of the first quarter in 2022, that's when the budget could absorb as we have some cost savings. So we put the cost savings into good use by bringing back our temporary staff as retired Newtons in late April 2022. and in late October of the same year to help with some of our processing applications. We were also able to offer overtime for staff to review and process additional applications. And in the second quarter of 2022, we also onboarded our special projects coordinator to provide on-demand support to the unit. And in the third quarter of 2022, we successfully backfilled the licensing analyst vacancy in October. We were also able to redirect an office technician position to the licensing unit in late October to help with administrative work. So you can see how that impacts the processing time by comparing it to the vacancy staffing rates here on this graph. And then on the next slide, we talked about aside from utilizing the cost savings, we also implemented these short-term, temporary, and long-term permanent solutions to address the turnaround time. For the short term, we have the following personnel continue to temporarily assist with the unit. And on the next slide that we talk about the various long-term solutions, two items have changed since the report at the February meeting. So the first is relating to the budget change proposal that we are working with the department on a draft for submission. And then the second is that we now have the redirected office technician on board. We have since implemented new processes to modernize the handling of our incoming application materials. For example, we stopped printing and have switched to scanning and uploading the application materials so that we can create an electronic record for all incoming information through the mail. And we also have enhanced the acknowledgement of receipt process now that our technicians sending and email acknowledging receipt of all incoming application materials that is received outside their application package. So this, we hope that this will bridge the previous communication gap that we didn't have due to the lack of staff. And these are related to Paperlite transition. We are also working with the Organizational Improvement Office to update our business process maps that were completed previously. If you might go back to the last slide, it would be appreciated. Thank you. Here we also talk about brief changes. So new enhancements are being deployed. Some of the examples were given to you by Ms. Xiong. We also have a few other new changes is that we have new indicators to help us track records better. For example, if we can determine if an incoming applicant is already licensed in another state. We have updated our public-facing information on the DCA, the Department of Consumer Affairs license search directory relating to psychological associate registration information. And then we are also working to onboard some application online, such as the Law and Ethics exam retake examination application. We are hoping to have that go live or launch in the late summer, if not earlier, and we're very excited about this new feature. And next slide, please. So with the hard work of the licensing staff and the help of the above temporary personnel positions and moving through the various long-term solutions, this is where we are about our processing times. As of April 13, 2023, our turnaround time is about 5 to 8 weeks for psychologist applications and about 2 to 3 weeks for psychological associate registration. This information, as mentioned by Ms. Xiong earlier, is also posted on our website approximately every 2 weeks. And this concludes my update, and I'm available for any questions that you may have. And thank you very much.
Thank you, Ms. Zhang and Ms. Chung, for a thorough presentation. I'm going to open it up to the board members. Does anyone have any comments or questions for either? Dr. Rogers and then Dr. Harpsheets.
Okay, thank you, Dr. Tate. Thank you so much for this presentation. It was super informative. And I just want to commend you for all of the hard work that you have done to bring some of this processing time down. It's fantastic. So I just want to let you know how much I appreciate it. I do have a question about the psychologist application workload report on page 129 in the combined packet. In the section that looks at the initial application for psychology licensure. So I see that there, in terms of the number of open applications, it was going down toward the latter part of last year, and then it started to creep up a bit in January, February, and March. I just wanted to know if you could talk a little bit about why those numbers are creeping up, if you have any thoughts on that. And then a second question is, what is a sweet spot for this particular division? What would you say is your ideal time frame between when you are receiving applications and processing them? And that's all. Thank you.
Thank you, Dr. Rogers. So about the workload report that you mentioned, so the bar, this graph actually showed the application that analysts worked on. So it could be, so if you see the red bar, it could be is something that came in and then analysts review it but was not able to approve it just yet. So then that kind of means what it means for the red bar if it's like it's not, the number's not going down. And then when it's going up, it means that it also indicates that because this is related transaction that in the back end that we do when we approved eligibility for the exam. So this is like an transaction that is necessary to remain opened for the system to work properly in communicating with other interfaces. So that's why you see, when you see the increases of the red bar, it could also indicate that more applicants are being approved at that time because this application transaction is being opened as a follow-on transaction in the system. I hope that makes
Yes,
sense.
no, that's
Sorry.
very, very helpful. Thank you for providing more context. That's really helpful. Thank you.
Absolutely. And regarding your questions on the sweet spot of the application processing timeframes, I think when we were at back in before the fund situation, I think that would be a good benchmark for us to go by because we were at a very good position at that time. We were fully staffed. We were able to respond to our applicants, stakeholders' needs in terms of the application processing. So I think that would be a good benchmark for us. And of course, if there's any more room for improvement, we will strive for that too.
Okay, Ms.
Thank
Chung.
you.
Thank you so much. I appreciate it.
Of course.
Dr. Harpsheets?
Thank you. I just want to echo what Dr. Rogers said, congratulating you and your staff, Ms. Chung, on the responsiveness you've shown to the needs of our stakeholders, which of course the public ultimately benefits as we get more and more psychologists out there providing service. I just wondered if you could just explain for us when you were saying that the processing time, I can't remember if you said 6 to 8 weeks. I think you said, Ms. Chung, but correct me if I'm wrong. What are the steps? You know, a person you receive the initial application. What steps happen between the receipt of that and the end of that application processing time, just so we can all understand what's going on during that?
Thank you, Dr. Hopshis, for the question. So the steps is when we received an application or additional application materials outside of the packet that we receive, we will process them first. It has to go through the cashiering processing if it is fee related, and then that is the first step. And then once that is done, then it will provide to our licensing technicians. They will handle those incoming mail and application information. We scan and make an electronic record of it, and then we assign them to analysts. And then it will be in the analyst queue for waiting for a review and process. Because application comes in on a flow basis, so we process and review them by the date that we receive them. That would be the most fair and transparent way for us to handle application and their materials coming in. So that the time that we posted online, it will be the time that is like from what I described from we received it until an analyst able to review it in their queue.
So it sounds from what you're saying that some of that time in the cashiering process and the receipt of documents, if they're not all there, is not necessarily all in your control. Did I understand that right?
Yes, of course. We are kind of more like reactive because we were able to review and process according to what we receive. So yes.
Okay, thank you. That helps me. Thanks.
No problem.
Any other board members have questions? Oh, Dr. Harpsheets, are you back again?
No, I'm just trying to get the hand down. It's just not working. So no, I'm going to get it down.
No worries. Any other board members have comments or questions before I open it up for public comment? Great. Ms. Moderator, can you please open up public comment for agenda item number 14?
Absolutely. So if anyone has any questions or comments on the licensing report, we would ask that you look for the question mark icon in the lower right corner of your WebEx screen, type the word comment in that text box and click send. The other option is to raise your hand by clicking on the hand icon, and our call-in users can press *3 to raise their hand. Is there anyone who'd like to make a comment on the licensing report? And I do not see any requests for comment. Shall I close that public comment feature?
Yes, and thank you for your help.
Welcome.
And that is an information only item. So we're moving on to agenda item 15, which is the continuing professional development and renewals report. Ms. McCochran.
Hi, good afternoon. So I'll be presenting the CPD and renewals update. So the pass rate from 2017 to 2022 has been consistently over 80%, with a drop in 2021 to a pass rate of 73%. The main reason cited for failing the audit was mostly related to concerns around the COVID-19 pandemic, such as office closures and inability to access or reproduce certificates, or an assumption that the live requirement was waived. The pass rate from 2017 to 2021 has been consistently over 80%, and the pass rate for second audits has been over 80% since 2017, with a 100% pass rate in 2021 and 2022. Audits of the 36 hours required for renewal will resume in June 2023. For renewals between January 2023 through April 2023, 81% of psychologists renewed as active, and approximately 90% of psychologists and psych associates renewed their license online using Breeze per month. So I just wanted to provide an update on CPD, but I want to first provide some background on why CPD was created. So back in 2012, the Association of State and Provincial Psychology Boards presented a new model of continuing education called the Continuing Professional Development Model. That same year, the legislature wanted to know the board's efforts in continuing competency. The board's response to this was that it was working to replace the single requirement of traditional continuing education courses with a more robust continued competency model. Thus, CPD was born. This model consists of 15 continuing professional development activities grouped under 4 different categories. CPD is a broader concept referring to the continuing development of the multifaceted abilities needed for quality professional performance in one's area of practice. So the most recent updates for CPD is that the CPD video and the FAQ have been created and posted to our website. I wanted to also provide a quick comment about the CPD credit for attending this meeting. So your attendance is recorded when you signed in and provided your name and email address. To keep record of your attendance, you would list today's date, May 19th, 2023, the name of the meeting, which is board meeting, and the number of hours attended. So 1 full day of board meeting will equal 6 hours credited. So if you attended for more than 3 hours, then you would get 6 hours credit. So this concludes my CPD and renewals report, and I'm happy to answer any questions you may have.
Thank you so much for your report. Are there any board members who have questions or comments from Ms. McCochran? Dr. Rogers.
Thank you, Dr. Tate. Ms. McCochran, I just wanted to make a comment about the FAQ page. It's so incredibly robust. And I just want to say what a great job board staff did with compiling all of the questions and all of the really thorough answers. I hope it will be helpful for licensees as they're trying to navigate this new model. So thank you so much for all of your hard work.
Thank you.
Any other board members? I'd like to chime in with Dr. Rogers. Thank you for being so patient with all of the questions and explaining several times to psychologists about the CPD requirement. I know it's new and change is sometimes difficult, so I appreciate your efforts. I don't see any other board members' hands. I'll wait a second. Ms. Moderator, can you please open up public comment for item 15?
This is Dr. Harb Sheets. I put mine up kind of last minute. Could I just ask Ms. McCochran one more question?
Absolutely.
So Ms. McCochran, when you're saying that if a person listens in on one of our meetings, let's say, and let's say we've talked before, if the meeting is 3 hours or less, they can get 3 hours credit. If it goes over 3 hours, they can get a full 6 hours. But I'm just wanting to clarify, if a person stays on the meeting for 3 hours and 15 minutes, are we saying that they can claim 6 hours even though the meeting, let's say, has continued on?
Yeah, they would be able to, because if more than 3 hours, they would be able to claim the full 6.
Okay, thank you.
And we just round up. But the rounding up piece is what the board is like, what we would say. I would not advise the licensees to round up, if that makes sense. You know, if they say 2 hours and 15 minutes, you could just report that. You don't have to round to 2 out to half or a whole, if that makes sense.
Yes, thanks.
Any other board comment? Ms. Moderator, can you please open up public comment for item 15?
Certainly, and we've opened up the WebEx Q&A feature to facilitate public comment. If you'd like to make a comment on the Continuing Education and Renewals Report, you can look for the question mark icon, type the word comment and send, or raise your hand by clicking on the hand icon. We do have a request for comment from Patricia Masuda Story. I'm going to send you a request to unmute, and you'll have 2 minutes with a 30-second warning. And you're unmuted.
We've already done more than 3 hours. We could technically log off and just claim 6 hours right now.
Yes.
Thank you.
Welcome.
And I do have another question from Marilyn Imuz. Marilyn, I'm going to send you a request to unmute your microphone. One moment. And let me see. Marilyn, I'm having trouble finding your name in the list. One moment. All right, Marilyn, I think you might be. Oh, you're in the D's for doctor. My apologies. All right. So I sent you a request to unmute your microphone.
Can you hear me?
Yes, we can.
Hi, I'm Dr. Imos from the California Department of Corrections and Rehabilitation. And I was just wondering, have you gotten quite a few inquiries in spite of the information on your website with specific questions regarding CPD? Because we've gotten a few, and I'm, trying to field those questions to your website, which I've been able to do. But there's still a few coming in that have questions specific to operations, what we do, and things like peer review and peer consultation, which I think are pretty clear. But I was just wondering, some people are still kind of in the dark about some of the areas of CPD. What does it look like with your organization? Have you gotten many inquiries?
Yeah, we get a lot of inquiries. A lot of them are very nuanced, so that's why I didn't place that in the FAQ. And if there are more detailed and specific questions, just email BOPCE. It's bopce@dca.ca.gov.
Okay. I'll let them know. BOP CE, no dot after BOP?
No dot after BOP, just BOPCE.
Okay.
My apologies. I thought she was done. One moment.
Hi, I was writing and I just wanted to say thank you. I appreciate that. I knew there was going to be a lot of questions at the beginning of this because it's new and people want to do the right thing, so they're kind of worried, but we'll get through it. Thank you.
All right, and our next request for comment is from, let's see, Victor Shavira. Victor, I'm going to send you a request to unmute, and you'll have 2 minutes with a 30-second warning. You're unmuted. Okay, Victor, we're not hearing you.
Yeah, hi, this is Victor Shavira. Can you hear me okay?
Yes.
Thank you. So I have two brief questions. One is the opposite of leaving the meeting before 6 hours. It was my understanding based on the agenda that it could go as long as 8 hours potentially if it ends at 6. So if we stay that long, do we get the full credit or just 6 hours is maximum?
Yeah, the maximum for a meeting is 6 hours for one meeting, but the maximum in the category of attendance at a California Board of Psychology meeting is 8.
Right. Okay. I was just wondering in case this meeting went the full 8 hours, but I guess it's probably not going to. And if it goes, that's fine. I'll stay. But I was just curious about how long the meeting would go. Okay. My second question is with regard to any kind of guidance on the qualifying measures for the CPD criteria for outcome measures, utilization of outcome measures in our practice. If I understand the FAQ correctly, there's not specific guidance about which measures qualify. I'm assuming widely used is part of the criteria, but I just don't know if there's any plan to create more criteria for qualified outcome measures.
At this time, there is not a plan because that is something that the psychologist, it's the responsibility of the psychologist to research the best protocols or the outcome assessments and to make sure that the measures are sensitive to cultural and diversity issues. But that is something in the future, you know, we can hold on to that. And
yeah, that would be my suggestion. I mean, I think it's pretty clear, but I really appreciate your answers. Thank you so much.
All right, and I do not see any other requests for public comment at this time. Shall I close the public comment feature?
Yes, please.
Thank you.
And we'll bring this item back to the board. I see that Dr. Kasuga has a question or comment. Go ahead, please.
Yes, thank you so much. I just wanted to welcome everyone who is attending the board meeting to collect CPD hours. And I just wanted to direct everyone's attention to the CPD FAQ FAQ web page, and at the bottom there is the courtesy CPD reporting form. I find it very useful to note the type of activity and to put the dates right away. That way, when it's time for submitting your CPD, you have everything ready. So I find that very useful, and thank you, Ms. McCochran, for providing that as part of the FAQ sheet. I mean, page on the website. Thank you.
Any other board comment before we move on?
Oh, this is Dr. Harpsheets. I was going to comment on the question about outcome measures. And I think that becomes a clinical issue that each psychologist has to decide is most relevant. And I think when we've looked at that before, we recognized that we needed to leave that to the individual psychologist to identify. And I'm not sure that we would look at changing that simply because of the clinical nature of it. Just wanted to provide that.
Thank you, Dr. Harpsheets. Okay, I'm asking any other board members for this item? Perfect. This is just information only, so we'll move on to item 16, the enforcement report. Ms. Monterrubio, please.
Thank you, Dr. Tate. Attached to my report, you will also find the overview of enforcement activity, which conveys the complaints investigations, and discipline statistics for this current fiscal year. The board is currently looking to recruit additional licensed psychologists for our expert reviewer program. Currently, we have 38 experts, and that's not nearly the amount that we actually need. Our expert reviewers do get paid $150 to $200 per hour, depending upon the services rendered for case reviews, preparation of expert opinion reports, and testimony at administrative hearings. The majority of our cases, though, do result in stipulated settlements, and that is where the board staff and opposing counsel agree to terms, and then it goes to the board for vote. So very few cases actually result in a hearing, which means experts are not needed to testify. So it's a very, very small percentage of cases, again, that go to administrative hearings. Expert reviewers are not advocates for the board, but rather advocates for the consumers of California. Our expert application can be found on our website. Actually, if you were to go to our homepage, it is under Quick Hits, and it's the fourth link down. And then there's an actual link there where you can click on to look at the application. So we've been sending out contact letters to eligible licensed psychologists to see if that could stir some interest in the program. As many of you know, we also publish articles in our journal. I'm trying to just recruit experts. So if anyone's interested, please again go to our website under Quick Hits. That's the fourth link down, and review the application and see if it's something that interests you, and please submit your application for consideration. Since July 1st of 2022, we have received 834 complaints. All complaints are opened and assigned to an analyst, and it looks like we're on track to receive approximately 1,000 complaints by the end of June. We have issued 30 citations since July 1st. And again, citations are issued for minor violations. We have referred 29 cases to the Office of the Attorney General for formal discipline, and we are currently monitoring 45 active probationers. And of the 45 active probationers, 2 are out of compliance, and we currently have 19 told probationers. And again, attached to my report is the overview of enforcement activities. So if the board or the public has any questions for me, please let me know.
Thanks, Ms. Monterrubio. I was talking to myself. Dr. Rogers, I see you have your hand up.
Thank you, Dr. Tate. Ms. Monterrubio, I have several questions for you. The first one is, can you talk a little bit about what the interview process might be for expert reviewers? So once they submit an application, what's the process of determining if the board will bring them on as expert reviewers?
Sure. So once the application is received, it is looked at by staff to make sure that they meet all of the requirements. If so, then it's going to be sent over to former board members to review, and also review the CV attached to the application to make sure that the individual is eligible. There is no face-to-face interview. It's really just looking at the application, making sure that they meet the criteria. And then, as I mentioned, having former board members take a second look at that application to make sure that they do qualify. If they are eligible and meet the qualifications, they then are asked to attend a training. So they have to attend a board training to be a reviewer before they can actually start reviewing cases. And that training is held with the Office of the Attorney General, board staff, as well as a representative from the Division of Investigation. It is a day-long training. And during that process, we kind of go over the do's and don'ts of being an expert. One of the don'ts is don't assume that because we're sending you a case that means there's a violation. Again, we are lay people, so we're asking for the licensees to let us know whether there's been a departure from the standard of care. But that's really the process and how we determine who is eligible. And then through the training also having the Attorney General's office there to kind of go over different scenarios with the experts. So what they'll do is they'll present a couple of different situations and then ask for the attendees to let them know whether or not there's been a violation. So it's very interactive, and we've received some really positive feedback as to how the training goes. We also have training materials that we provide for the experts to even reference back to at a later time if they're maybe needing some clarification as to a certain process. So we do provide those materials to them again for them to reference back at a later date.
Okay, that's really helpful. Thank you so much. And then my next questions are about expert reviewers when they are given cases. What's the typical caseload for reviewers at any given time, or does that vary depending on the number of complaints that come in and the type of expertise the reviewers have? So that's part one. And then the second second part of that question is, do reviewers get CPD credit for reviewing these cases or no?
To attend the training, they do get CPD credits. I believe it's 3 to 4 hours, but I'd have to double check. But they do get it for the one-day training. In regards to the workload, it really just does depend on the amount of complaints that we are receiving and what area of expertise we need. So what happens when we get a case that needs to be reviewed by an expert, we will first contact the expert to see whether or not they have a conflict of interest. We obviously don't want our experts reviewing cases against someone they may have a relationship with. So that's the first step. If they let us know that they don't know this individual and there isn't a conflict, we do ask that they review the case within 30 days. Now that day can't always be met because the experts are working, and we understand that. So they may have a heavy workload themselves, and so we try to work with them on the time frame. But there are times that, let's say, we need an expert in neuropsychology, and maybe we only have about 5 that are in that area of expertise. We may have to have cases sitting for just a bit so that the expert has enough time to thoroughly review everything. They may have 2 other cases pending with them already. So again, because we only have 38, we do definitely need to be understanding of the amount of time an expert may need, but it really just depends on what area of expertise we're looking at. I hope that answers your question, Dr. Rogers.
No, sure. No, that's really, really helpful. Okay, just bear with me. I have a few more questions.
Sure.
Okay, on page 146 in the combined packet, I think this is just a typo. Under probation program, it says there are 3, and then in parentheses, it says 2 that are out of compliance. So I heard you say 2 when you were
It's 2,
speaking.
Dr. Rogers.
Okay.
Thank you so much for pointing that out. Yes, that is a mistake. It is 2.
Okay, 2. Okay, and then on page 148 of the combined packet, let me get my columns together. So in the column for 21-22, under total filings, that number is 28. But when I was calculating it, I think it's 40. Is my math incorrect?
When you say total filings,
Yes,
okay, sorry,
under,
there we
I'm
go.
so sorry, under enforcement outcomes and where it says total filings at the bottom of that section. So just above total filings withdrawn, dismissed.
You are correct. That is not 28 because just with accusations, it's 29.
Right.
And so then you have 4 statement of issues and 4 petitions for penalty relief, and then 3 petitions for reinstatement. So that number is incorrect.
Okay. And then on the same page, last category, violation types. I was just curious about the columns for 21, 22, and 22, 23. There are a few that are bolded, and I didn't know if there was any reason that those numbers were bolded in particular. If there's
No, there's no reason for those to be
Okay.
bolded.
I
That's
did-
just
Okay. I didn't know if I needed to be paying particular attention to those for some reason or not. So I just wanted to
No.
clarify. Okay. That is all I have. Thank you so much, Ms. Monterrubio. I really appreciate it.
Thank you, Dr. Rogers.
Any other board members with questions or comments for Ms. Monterrubio?
Oh, this is Dr. Harpsheets. I was just going to answer one part of Dr. Rogers' question that experts can claim CPD credit up to 12 hours maximum under the professional activities category.
Here's what I found.
Thank you so much, Dr. Harpsheets. That's really helpful.
Sure.
Dr. Harpsheets, are you trying to put your hand down again?
Yes, I keep having to do it. I keep clicking and it doesn't go down. So yes, I'm trying to get it down.
No problem. Dr. Rogers?
I
are you
did
doing
put I put my hand back up. I was just wondering, thank you so much, Dr. Harpsheets, for mentioning the amount of time that expert reviewers can get for CPD. I'm wondering if we post a call for reviewers in the next newsletter, if we might be able to mention that as well. I'm just thinking of different incentives that might draw people to want to apply.
I think that's a great idea. We definitely can include that they could earn the CPD by attending the one-day training. Absolutely.
Okay. Thank you.
I do not see any more board member hands. Ms. Moderator, can we please open up public comment for the enforcement report?
We can. Oh, but it looks like Dr. Kasuga.
Oh, okay, before we move on, Dr. Kasuga.
I am sorry. What Dr. Rogers mentioned just reminded me that aside from the incentives of being an expert, with regards CPD, it's also very helpful for our profession to provide this service. So I really encourage all psychologists that are in this call to consider being an expert for the board for your particular field of expertise in psychology, especially neuropsychology, assessments, different types of therapies, because the more we have as a pool of experts, the better we'll be able to keep the quality of our profession. So I just really encourage everyone to consider it. It's such a big service for the profession to be able to serve in that capacity.
Thank you, Dr. Kasuga. Ms. Moderator, can we open up for public comment?
Absolutely. So we've opened up the WebEx Q&A to facilitate public comment. If anyone would like to make a comment on this item, you can look for the question mark icon, typically in the lower right of your WebEx screen, type the word comment and click send, or you can raise your hand by clicking on the hand icon, and our call-in users can press *3 to raise their hand. We do have a raised hand from Sonia T. Valar. And Sonia, I'm going to send you a request to unmute, and you'll have 2 minutes to speak. You're unmuted.
I looked at the requirements for the expert reviewer and was dismayed to see that there's a requirement for active practice of 80 hours per month. I've recently retired and I have a very tiny small practice, but this sounds like something that many retirees would perhaps be not only expert at, but interested in doing. So I'm curious as to why that large hurdle exists. If you are in need of getting expert reviewers, perhaps that is a requirement that could be adjusted so that more of us could qualify to apply.
Hi, this is Sandra. That's a great comment. We've actually been told by the Attorney General's office that it is important that the individuals that are testifying do need to be working. 80 hours was a number that was discussed with the Attorney General's office as well as our enforcement committee. So it's not something that staff just kind of came up with. I do think we could maybe discuss that again at one of our upcoming enforcement committee meetings, but again, that number was decided on by the Attorney General's office as well as our enforcement committee. But again, I can mention this at our next committee meeting and see what the committee would like to do.
Well, thank you for that consideration. I think it might address some of the issues of timeliness, because after all, if I'm retired, I have plenty of time to investigate and work on this, and I wouldn't have to delay due to workload. And it would probably broaden the number of applicants who would be interested in participating in this program. Thank you.
You're welcome.
And this is the moderator. I do not see, oh, let's see, June Hayes. I'd be happy to send you a request to unmute your microphone so that you can add your comment. I'm just sending you the request now. And June, did you get? Oh, June, there should be a pop-up on your screen that says unmute me. Although I can also read aloud the comment that you sent. June Hayes has said, I also am interested in an expert program. I work on only about 35 to 40 hours per week at this point. So that is another comment from an attendee. Per month, not per week. And I do not see any other requests for comment at this time. Shall I close the public comment feature?
Yes, and thank you very much.
You're welcome.
Before we move on, any other board comment? Perfect. This is an information only report, so we can move on to item number 17. This is review and possible action on supervision agreement plan for supervised professional experience in non-mental health services. Ms. Chung.
Thank you, Dr. Tate. This item, we are asking the board to review the supervision agreement plan in the attachment. The background for this is because we received an application for psychological associate registration from an individual who expressed interest in accruing hours in the non-mental health services field. And then regulations require us to present this to the board to get an approval. So please review the plan and whether to approve, disapprove, or amend. And a brief background on this regarding the plan, where the applicant will be wishing to do is that they would like to be supervised for providing organizational consultation services, running psychoeducational programs, and providing psychological support for individuals experiencing organizational transitions. More details is in the attachment. Thank you.
Thank you, Ms. Chung. Any board comment regarding this document?
This is Dr. Harpsheets. Ms. Chung, is this the first time we've seen something like this?
Dr. Harpsheet, thank you for questions. The last one, I believe, if I remember correctly, it was back in 2018 that we might have one that came our way. So it has been a while that we received one.
Okay, and can you tell us what historically have been the concerns that we should consider as we kind of sort through what we might want to do with this? What should we be thinking about?
I believe, if I remember correctly, the board usually review if there's adequate supervision or if the work is appropriate to be designated in the non-mental health setting. I think those are the major points that I could remember.
Okay, thank you.
Nope, no problem.
Any other concerns, questions? Mr. Fu.
Thank you, Madam President. I'm actually really curious to hear from Dr. Harpsheets as our licensure chair, which I suspect this would probably come under her jurisdiction in committee if there was a committee hearing beforehand. And so I'm curious, given the guidance that Ms. Chung provided and your review of the plan, if you have thoughts and reflections on where you see this fitting in pathways to licensure.
Yeah, as I look at it, that's why I asked the question about, what are the considerations, what would be our concerns, because nothing stands out to me as a particular concern. The person is being supervised, and you look at all the check marks on the application, and they seem to fit our guidelines and regulation on what needs to happen in supervision. And then it made me wonder, do other people, and this would be a question for Ms. Chung, do other people do these kinds of activities and they're not psychological associates? So in other words, they do this kind of work in a, let's say, a business related setting, and then maybe never get licensed, but perhaps this particular person is wanting to accrue hours and working towards licensure, and that's why they are wanting to do it this way. So can you clarify that for us, Ms. Chung?
Yes, I believe this person is seeking a registration. Since registration to be a registered psychological associate is one of the pathways that allow an individual to accrue hours, and it appears that the person would like to accrue some hours that would be eligible for licensure later on. So that's why they are submitting to us a plan, because the regulations required if utilizing this registration path to accrue hours in a non-mental health setting, the plan must be first approved by the board first. So that's why we are seeing this here.
Okay, so it seems like, some people will graduate with a specialty in organizational development and then choose to never get licensed and work in business settings. And we never hear from these people. But in this case, this person does want to engage in pathways towards licensure, and that's why we're seeing this, correct?
Yes, that's my understanding.
Yeah. So, as I look at it, and I'd be interested in what other board members say, there are all these boxes that are checked off, yes, yes, yes. That satisfies for me, it provides a level of confidence for me that the supervision is going to be, what we would be looking for. And I don't have any concerns about it. But I would definitely be interested to hear what other board members have to say if there's something that they see that I'm not seeing.
Hi, this is Leah Tate. I agree with you, Dr. Harpsheets. There's nothing that is a red flag regarding this application. And I'm actually happy that this person came to the board wanting of our stamp of approval. I like that and I prefer that. So
Yeah, that makes sense. That makes sense for me too. And we know that there are people doing this kind of work in business settings
yes.
without the kind of supervision that we would require.
Yes. Mr. Fu, do you still have a comment or?
No, it was a leftover hand.
Got it. Dr. Kasuga.
Yes, thank you. I was just thinking that this can be not just for industrial organizational psychology, but those that practice sports psychology and aren't doing any clinical work, mostly just doing performance enhancement. I think that can be some of the people that may be interested in a pathway like this.
So could I make a motion that we approve this supervision agreement? Is that what would be appropriate?
And I'm happy to
Yes.
second. This is Seiran.
Perfect. So we have a motion by Dr. Harpsheets, a second by Mr. Fu. Any other board comment before I go to public comment? Ms. Moderator, can you please open public comment for item number 17?
Certainly, and we've opened up the WebEx Q&A to facilitate public comment. If you'd like to make a comment on the discussion, you can look for the question mark icon, typically in the lower right corner of your WebEx screen. Type the word comment in that text box and click send, or anyone may raise their hand by clicking on the hand icon, and our call-in users can press *3 to raise their hand. Each speaker will have 2 minutes with a 30-second warning. Are there any comments? And I do not see any requests for comment. Shall I close the public comment feature?
Yes, please.
Thank you.
So this item is coming back to the board. Any last comments before Ms. Bruteau calls the roll? Perfect. This is a motion by Dr. Harpsheets and a second by Mr. Fu. And Ms. Bruteau, can you please call the roll?
Kasuga.
Aye.
Fu.
Aye.
Harpsheets.
Aye.
Nystrom.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you.
Perfect. Thank you so much. Motion passes. Let's take a 10-minute break until 2 o'clock, and then we will resume with agenda item 18. Thank you.